Ini kita akan membahas soal kelapa kopior. Yang lantaran sulit didapat, jenis kelapa yang satu ini memang dikenal sebagai bahan campuran minuman dengan harga yang cukup mahal.
Iya, betul sekali Naomi. Ini namun seorang dosen dari salah satu perguruan tinggi di Purwokerto, Jawa Tengah sukses mengembangbiakan pembibitan tanaman kelapa kopior dengan sistem kultur embrio.
Di atas area seluas 2 hektar ini, pembibitan kelapa kopior dengan sistem kultur embrio dikembangkan. Meski ukuran pohon kelapanya lebih pendek dibandingkan dari biasanya, namun jumlah panen buahnya justru tak kalah hebat. Adalah sosok Si Sunandar yang sukses mengembangkan kelapa kopior dengan sistem kultur embrio untuk pertama kalinya di Indonesia. Awalnya, dosen program studi biologi Universitas Muhammadiyah Purwokerto ini telah melakukan penelitian tentang pengembangan kelapa kopior sejak tahun 2004. Seusai meraih gelar doktornya di Australia, Si Sunandar mengembangkan kelapa kopior dengan kultur embrio menggunakan metode ex vitro rooting. Ia pun berhasil mengindukasi akar dan mengadaptasi benih kelapa kopior dengan tingkat keberhasilan 90%. Dan hasilnya adalah tanaman kelapa dengan panen buah seluruhnya kopior. Sementara pada pembibitan konvensional, persentase buah kopiornya hanya berkisar 1 hingga 2 butir dalam satu tandan pohon kelapa.
Sebenarnya semuanya sama. Pemeliharaannya, pemupukannya, bahkan hama penyakitnya semuanya sama. Kecuali benihnya yang berbeda. Kita pakai kultur jaringan. Tapi kultur jaringan belum dari 1 belum bisa jadi 1000, baru 1 masih jadi 1. Namanya kultur embrio.
Satu tandan dari tanaman kelapa kopior hasil kultur jaringan ini bisa menghasilkan hingga 15 buah dengan rasa yang menggiurkan.
Bagi saya sendiri yang sudah merasakan kelapa kopior ini tentunya sangat renyah, gurih, terus juga manis, dan tekstur dengan bentuknya itu juga sangat berbeda dengan kelapa yang biasa. Kesannya ya saya sangat senang sekali ya, karena ini juga saya pertama kali baru mencoba kelapa kopior ini dan ternyata rasanya benar-benar mantap.
Enak ya Mbak?
Enak banget.
Hingga kini, hasil kelapa kopior temuan Si Sunandar telah dikirim ke berbagai kota di Indonesia. Dan jika Anda tertarik menanamnya, bibit kelapa kopior ini dijual dengan harga berkisar Rp1 juta per pohon. Imam Ambarwoto, Purwokerto, Jawa Tengah.
Kita mulai informasi pertama hari ini, pemirsa. Salah seorang peneliti kopior dari Universitas Muhammadiyah di Purwokerto meraih gelar Profesor Kopior yang pertama di Indonesia. Uniknya, proses pengukuhan gelar ini dilakukan di areal kebun kelapa kopior yang merupakan kebun plasma nutfah terlengkap di Indonesia.
Si Sunandar, seorang dosen sekaligus peneliti kelapa kopior, meraih gelar Profesor ke-7 di Universitas Muhammadiyah Purwokerto. Dirinya sekaligus menjadi profesor pertama di Indonesia yang secara khusus meneliti dan mengembangkan kelapa kopior. Si Sunandar sendiri tertarik dengan kelapa kopior karena budidayanya dengan metode alami cukup sulit dilakukan. Sejak tahun 2008 lalu, Si Sunandar secara spesifik meneliti dan mengembangkan metode pembudidayaan kelapa kopior yang saat ini mempunyai nilai komoditas yang tinggi. Melalui teknik kultur jaringan, Si Sunandar mampu membuat keberhasilan budidaya pohon kelapa kopior ini mencapai 95%. Bahkan, proses pengukuhan gelar profesor ini pun dilakukan di tengah areal perkebunan kelapa kopior milik Universitas Muhammadiyah Purwokerto sebagai satu-satunya kebun plasma nutfah kelapa kopior terlengkap di Indonesia. Rektor Universitas Muhammadiyah Purwokerto, Anjar Nugroho, mengatakan UMP Purwokerto sengaja mengukuhkan gelar Profesor Si Sunandar ini di tengah kebun kelapa dengan tujuan memperkenalkan kebun kelapa tersebut kepada tamu undangan.
Mengajak para hadirin untuk melihat dari dekat karya Profesor Sunandar berupa kelapa kopior yang ditanam di kebun kelapa milik Universitas Muhammadiyah Purwokerto.
Ini kebun plasma nutfah paling lengkap di Indonesia berarti ini Pak?
Iya, insya Allah ini adalah paling lengkap. Jenis-jenis kelapanya berasal dari berbagai daerah. Dan insya Allah ini adalah representasi jenis-jenis kelapa yang ada di Indonesia yang dikopiorkan.
Sementara itu, Profesor Sisunandar mengatakan jika dirinya tertarik dengan pembudidayaan ini karena Indonesia yang sangat kaya raya akan varietas kelapa. Sulitnya pembudidayaan kelapa kopior ini juga membuat dirinya membuat kebun plasma nutfah yang paling lengkap di Indonesia dan berharap pemerintah bisa memproteksi kekayaan hayati kelapa asli Indonesia.
Menjadi pionir juga untuk Indonesia masalah.
Ya, karena plasma nutfah ini sangat mahal. Beberapa peneliti dari luar pengen banget dapat plasma nutfah dan makanya ya proteksi.
Cara nanti proteksinya seperti apa, Prof?
Yang pasti kita tidak akan menjual butirannya. Karena di dalam butiran kopior itu ada embrionya yang bisa ditumbuhkan di mana saja. Kita tidak, dan harapan saya pemerintah Indonesia saat ini tidak menjual kelapa butiran keluar karena di dalam kelapa butiran itu ada plasma nutfah yang kalau kita jual ke luar negeri itu kita juga jual plasma nutfahnya.
Saat ini, Indonesia merupakan penghasil kelapa terbesar di dunia. Meskipun begitu, masih banyak petani yang berada di bawah garis kemiskinan. Sisunandar berharap, karyanya ini nanti mampu meningkatkan penghasilan para petani kelapa kopior. Dari Purwokerto, Dirbe Tias, Metro TV.
Terima kasih. Anda masih di Net Jawa Tengah. 3 mahasiswa Universitas Muhammadiyah Purwokerto melakukan penelitian dengan bahan kulit semangka. Hasilnya, mereka sukses membuat gel anti jerawat yang bisa membantu mengatasi jerawat bandel pada wajah. Seperti apa? Ini dia.
Yola Anggraini, Tika Ambarwati, dan Irmas Miranti. 3 mahasiswa Fakultas Farmasi Universitas Muhammadiyah Purwokerto ini berhasil memanfaatkan kulit buah semangka menjadi penemuan bermanfaat, yakni gel anti jerawat. Ide tersebut berawal dari banyaknya limbah kulit semangka dan juga permasalahan jerawat yang umum dialami kaum muda. Dari hasil penelitian, ternyata kulit semangka memiliki senyawa aktif yang berfungsi sebagai antibakteri.
Kami satu tim itu untuk mencari tahu dari isi kandungan kulit semangka itu apa, dan salah satunya itu untuk anti jerawat. Terus kita berpikir biasanya kan yang biasa bermasalah anti jerawat itu kan remaja. Jadi kami memiliki inovasi itu dari situ, Pak, dari permasalahan itu.
Sebelum jadi gel obat jerawat, mereka membuat ekstraksi kulit semangka. Lalu, ekstrak dicampur dan dihaluskan bersama zat lain, serta bahan pembuat gel. Setelah itu, para mahasiswa lakukan pengujian laboratorium. Hasilnya, gel dapat menghambat pertumbuhan bakteri penyebab jerawat.
Jadi ini tahap kedua setelah ekstraknya terbukti secara ilmiah.
Terus ke depan mau seperti apa?
Kalau ke depan mungkin nanti akan dilakukan uji lanjutannya, Mas, macam praklinis sama klinisnya. Tapi sebelum klinis mungkin praklinis ya, karena praklinis juga cukup banyak sih, apalagi ini topikal.
Kedepannya, jika segala uji berhasil, gel ini tentunya bisa diproduksi massal dan menjadi alternatif obat berbahan alami untuk mengatasi jerawat. Bayu Nur Sasongko melaporkan untuk NET.
Wah, dari sini pun juga langsung terasa kesegarannya ya pemirsa wisata Blue Lagoon tadi. Kita beralih ke informasi selanjutnya. 3 mahasiswa dari Universitas Muhammadiyah Purwokerto tahun ini berhasil mengikuti seleksi Pekan Ilmiah Mahasiswa, mengisikan ratusan karya lainnya. Hal ini berkat inovasinya yang menjadikan lendir bekicot sebagai pasta gigi yang bahkan diklaim mampu mencegah kerusakan gigi dan penyebab gigi berlubang. Seperti apa khasiat dari lendir bekicot ini, kita lihat. Hewan bekicot biasanya terkesan menjijikan jika kita melihatnya di halaman rumah atau kebun. Namun ternyata bagian lendir dari hewan moluska ini diklaim mampu mencegah kerusakan gigi dan dapat mengobati gigi berlubang. Adalah 3 mahasiswa asal Universitas Muhammadiyah Purwokerto, yakni Novita Fitri Kurniasih, Rahma Fauzia Madaningrum, dan Nur Fidian Hasanah, mahasiswa Fakultas Farmasi semester 6, yang menemukan inovasi dari lendir bekicot. Dalam penelitiannya, lendir bekicot ternyata memiliki kandungan protein acasin yang berfungsi sebagai reseptor enzim bakteri. Kandungan inilah yang kemudian digunakan sebagai penghambat pertumbuhan bakteri Streptococcus mutan yang menjadi penyebab kerusakan gigi. Dengan berbagai campuran khusus seperti xilitol, peppermint, natrium benzoat, dan zat selulosa, lendir bekicot kemudian dicampur menjadi adonan pasta. Hasil ramuan inilah yang kemudian menjadi pasta gigi yang dijuluki dengan nama pasta gigi gelecot.
Kami itu ingin merubah message dari masyarakat sendiri, di mana bahan yang tidak berguna menjadi sesuatu yang berguna dan bermanfaat tentunya untuk masyarakat Indonesia, terutama untuk pencegahan karies gigi.
Kalau di lendir bekicot ini kandungannya apa sih Mbak? Oh, bisa digunakan?
Untuk kandungan lendir bekicot ini terdapat protein akasin yang dimana dia itu mampu menghambat, di mana protein akasin ini merupakan salah satu faktor protein untuk menghambat adanya pembentukan sekutu di bakteri. Jadi itu dapat berpotensi sebagai penghambat bakteri Streptococcus mutan, di mana bakteri Streptococcus mutan ini merupakan salah satu penyebab karies gigi.
Proses penelitian dan inovasi lendir bekicot ini dilakukan sejak bulan April lalu setelah proposal penelitian ke Kemenristek-Dikti disetujui. Hasil inovasi ini yang mengantarkan ketiga mahasiswa Fakultas Farmasi Universitas Muhammadiyah Purwokerto lolos dalam seleksi Pekan Ilmiah Mahasiswa tahun 2019, mengisikan ribuan peserta lainnya di Bali pada 27 Agustus 2019.
Karena bisa menghambat pertumbuhan bakteri. Sedangkan di wall kita kan itu ada bakteri Streptococcus mutan. Nah, kalau misalnya itu kita sikat gigi pakai yang ada zat aktifnya itu lendirnya, nah otomatis nanti ada mekanisme menghambat. Dari ribuan, kemudian kalau dari Universitas Indonesia mungkin yang lolos 126 universitas. Kalau dari judul dari ribuan berarti hanya 250.
Meski pasta gigi lendir bekicot telah terbukti sebagai bahan aktif penghambat kerusakan gigi, namun hasil penelitian ini masih harus melalui uji klinis lainnya sebelum dapat diproduksi secara massal. Karya mahasiswa ini pun patut mendapat apresiasi atas inovasinya menggunakan bahan herbal dari hewan yang selama ini dianggap sebagai hama di kalangan masyarakat. Dari Purwokerto, Darby Tias, Metro TV.
Mengenal seni dan budaya asli Indonesia, sejumlah mahasiswa asing yang sedang menempuh studi di Purwokerto dikenalkan kepada musik gamelan. Para mahasiswa asing yang berasal dari sejumlah negara ini tampak antusias mempelajari alat musik khas Jawa tersebut.
Dibimbing seorang dosen, sejumlah mahasiswa dari mancanegara antusias mempelajari musik gamelan di Universitas Muhammadiyah Purwokerto, Banyumas. Tak hanya belajar secara detail tentang alat-alat musik tradisional, para mahasiswa asing tersebut belajar dan praktik langsung bermain gamelan. Diarahkan langsung oleh sang dosen, para mahasiswa asing nampak kesulitan dalam menabuh dan mengikuti instruksi sang pembimbing. Meski demikian, mereka terlihat asyik dan sangat menikmati memainkan alat musik khas Jawa tersebut.
I really like this kind of music. It's my first time actually playing it, and I'm really enjoying it. And I also like that it's not really difficult to learn. And
kind of hard some part, but it's easy to play. But it's hard to make a really music instrument to all gather up instruments.
You like playing?
I like, yeah, sure.
Is this your first time?
No. I studied every Friday. Dua bulan every 2 months.
Gamelan dikenalkan kepada para mahasiswa asing agar mereka tak hanya belajar akademik saja selama tinggal di Indonesia, tetapi mereka juga mempelajari seni budaya tradisional yang asli Indonesia.
Kebanggaan dari kita, pengenalan budaya kita di situ, yang notabene mereka dari luar kemudian belajar bahasa Indonesia, tapi di sini juga tidak hanya bahasa Indonesia saja, tapi budayanya juga. Ya, budaya gamelan di sini, budaya musiknya.
Dengan mempelajari
Mohon
seni dan
perhatian
budaya
Ibu,
Indonesia, diharapkan
silent please
mahasiswa
nggih.
asing ini dapat
Silent
menambah
please
wawasan
nggih.
dan pengetahuan
Ya,
selama
kita
di
akan
Indonesia.
mulai untuk kegiatan
Tak hanya
hari
pengetahuan
ini
akademis
nggih.
dan bahasa Indonesia, mereka juga tahu tentang kekayaan dan keberagaman seni tradisional bangsa ini.
Cek.
Bayu Nur Sasongko melaporkan untuk NET.
Wah, indah banget kan pemirsa. Nah, setelah lelah nih muter-muter taman bunga yang indah tadi, saya akan ajak Anda untuk berwisata kuliner nih, berburu kuliner tempe mendoan. Tapi kali ini bareng dengan puluhan mahasiswa asing dari berbagai negara nih.
Assalamualaikum warahmatullahi wabarakatuh. Innal hamdalillah nahmaduhu wa nasta'inuhu wa nastaghfiruh wa na'udzu billahi min syururi anfusina wa min sayyiati a'malina may yahdihillahu fala mudhillalah wa may yudlilhu fala hadiyalah. Asyhadu an la ilaha illallah wa asyhadu anna Muhammadan abduhu wa rasuluh. Amma ba'du. Welcome back to all excellency distinguished participants of the Second International Nursing and Health Sciences Conference 2021 event. Before the event starts, let us pray and praise to Allah Subhanahu wa Ta'ala, who has given His grace and guidance to all of us, that this morning we can gather at the Second International Nursing and Health Science Conference 2021 event. Salawat and salam always be praised to our great Prophet Muhammad Sallallahu Alaihi Wasallam, who has brought us from the darkness to the bright era with the light Dinul Islam. Please allow me, Maharani, and my partner Risha to read the schedule of the second day as follows. First, reading the rules of the conference. Second, opening. Third is conference panel session. And the last event is closing ceremony. The rules of the Second International Nursing and Health Sciences Conference 2021 are: participants will be given approximately 45 minutes to start joining the Zoom link. This is to ensure the conference to start on time. Participants' non-presenters ID name, non-presenter underscore name, underscore college name abbreviation. For example, NP underscore Hanif Prasetya underscore UMP. For participants who want to join concurrent session break room, are required to name their Zoom ID as stated below. Non-presenter underscore room number underscore participant's name underscore college representative. For example, NP underscore R1 underscore Hanif Prasetya underscore UMP. All conference participants' microphone will be muted by the Zoom host or co-host during invited speaker session. In the discussion session, participants may deliver the question directly or writtenly in the chat room. In order to receive the conference certificate, presenter and participant are required to attend the event until it is finished. Participants are prohibited from leaving Zoom during the conference session. Participants should use a specific virtual background provided by the committee. The second event is opening. Let's open this event with the reading of Al-Basmalah together. Bismillahirrahmanirrahim. The third event is panel session. We proudly invite the moderator to guide the panel session. Assistant Professor Susana Widyaningsi, Registered Nurse Master of Nursing Science. Allow me to read the CV of the moderator. Assistant Professor Susana Widyaningsi, RN, Master of Nursing Science. Graduated from Prince of Songkla University, Thailand. Lecture and clinical instructor in Medical Surgical Nursing Department, Universitas Muhammadiyah Purwokerto, Indonesia. To Ma'am Susana, time is yours.
Thank you, Risa and Maharani. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. It's been my great pleasure to be the moderator in the second day of the International Nursing and Health Sciences Conference 2021, hosted by the Faculty of Health Sciences, Universitas Muhammadiyah Purwokerto, Indonesia, and College of Nursing, Nueva Ecija University, and of Science and Technology, Philippines. Today's topic that we are bringing is the opportunities and challenges of interprofessional education across countries. I believe in the first day, all audience and speakers had very fruitful discussion. And in this second day, we're going to invite 3 distinguished speakers from 3 countries. They are Mem Jin from the Philippines, Ajan Wasana from Thailand, and Ibu Umi Solihah from Indonesia. 3 speakers will be in a panel session for 45 minutes for each speakers. Later on, we will give the audience approximately an hour for discussions. The audience can deliver their questions over the chat room or address the questions directly to each of the speakers during the discussion session. After the panel session is over and the discussion is over, we will also hand over the certificates for the conference speaker virtually. So without further ado, I will proudly invite our first speaker, Prof. Jin Nunis Guilasper, RN PhD, and I will read her curriculum vitae. Our first speaker in this conference is Professor Jin Nunis Guilasper, registered nurse, PhD. She gained her education, Doctor of Philosophy in Education Management, Nueva Ecija University of Science and Technology, as a faculty scholar in 2014. She also attended her Master of Arts in Nursing in Manuela V. Galepo Foundation College in the Philippines in 2009. Ladies and gentlemen, she also has quite some experiences in academic teaching. Recently, she teaches in College of Nursing, Nueva Ecija University, and Science and Technology as the teacher in Nursing Leadership and Management, as well as Nursing Jurisprudency. And she also teaches in graduate school, Education Management, Nueva Ecija University of Science and Technology, in the part of research methods, research in major fields, as the associate professor from 2016 until 2019. She also teaches in College in Nursing in Nueva Ecija University of Science and Technology, especially in the major of Nursing Leadership and Management, also Nursing Jurisprudence, Nursing Research 1, and Nursing Research 2. So these are completely her curriculum vitae. I believe all of the audience in this conference will be seeing that she has a very great experiences both in educational achievement as well as in the working experience. So ladies and gentlemen, We will proudly invite our first speaker, Professor Jean Nunes Gulasper, registered nurse, PhD. To Ma'am Jean, the stage is yours. Thank you.
Hi, ma'am. Hello. Thank you for very nice introduction. Good morning, everyone. Thank you for this opportunity to be with you today. Since yesterday, we are having our collaboration regarding research. And allow me to present my slides. Is it visible now?
Yes, it is very much visible, Ma'am Jean.
Yes, ma'am. So again, thank you, Ma'am Susan, for the very nice introduction. And hello, everyone. Hello to all the participants. I guess all over Asia and other countries. And I would like also to greet Rector Jabul, as well as Dean Umi, and the whole Health Sciences faculty and staff who work with us actually we are working with us and having our exchange of expertise as well as cultural exchanges in terms of student and faculty exchange. So I'm very much grateful to accept and share with you the interprofessional education, both in clinical and community setting in the Philippines perspective. When we speak of interprofessional education, as shown on the graphics in my first slide, it is somehow collaboration of different health education or different programs related to medicine or medical courses such as dentistry, medicine, pharmacy, somehow social work as part of the interprofessional education, public health, as well as nursing. So with this, the interprofessional education is the center of what we so-called learning or learning experiences. So yesterday, as I heard with the different speakers invited by Universitas Muhammadiyah Purwokerto, they have already defined interprofessional education. And when we speak of interprofessional education, again, I would like to emphasize that according to the World Health Organization, interprofessional education occurs when two or more professionals learn about, from, and with each other to enable effective collaboration and improve health outcomes. With this definition, we need to bear in mind that there are some keywords that we need to somehow remember. That is learning, with, from, and about, as well as each other. So meaning, when we speak of interprofessional education, we need also to enable effective collaboration as well as improve health outcomes. So that is the center of interprofessional education. So one of the questions that we need to address in interprofessional education is that, is there really a need for interprofessional education for clinical and community setting? Of course, the answer is yes, because primarily based on the first slide that I have showed a while ago, we need IPE to develop the depth of disciplinary knowledge necessary for the newly qualified graduates to be prepared for practice. And somehow, when we speak of interprofessional education, as I have emphasized a while ago, that learning from and with other health professionals students or education or the teamwork or collaboration with other health professionals usually occur in many kind of environment or in any kind of environment, including large classes like classroom discussion or the theoretical concept of each professional education in each discipline. That is also can be learned by means of small group tutorials as well as simulation and the clinical setting as well, clinical and community setting. So meeting the learning goals of IPE can somehow occur by means of planning adequately or properly, by means of collaborative learning experiences, but also through the unplanned encounters where the students are co-located in clinical placement. So in the Philippines, we do the IPE actually in the hospital and community setting. We barely do it in the classroom or in specifically in the theoretical concept, because specifically in our university, nursing is the only health education program that we have. So one of our limitation is that we cannot collaborate with other health education professional or program, because mainly the nursing in our university is the only health-related program. So we do it in the clinical area as well, or hospital area, as well as in the community setting, wherein we collaborate with other health professionals like medicine or medical courses, or those interns who are in charge to look for the patients who are admitted in the hospital as well as in the community setting. We work with other group of people, specifically we collaborate with the municipal health officer who is in charge in the community setting, the physician in charge in the community setting, as well as nurses who assigned in community, as well as barangay health workers. In the Philippines, we have barangay health workers who work with us in monitoring the health status of the community itself. So during in our curriculum, during the second year of the students in the nursing program, we have the community health nursing. And then the focus of that is we need to adopt a family wherein we could have this health education as well as monitoring of that specific health. When we adopt a family in the community area, we usually choose those family that needs health education, as well as those information that needs to for them to improve their health in terms of decreasing the incidence of acquiring diseases in the community. And then we need also to consider that in interprofessional education, we need also to have the support of the institution or the university in terms of the implementation of interprofessional education, because it means collaboration. We need also the support of the administration of the university or institution itself for us to work on with or in the development and maintaining effective interprofessional working interrelationship or relationship itself with learners, with practitioners, as well as with patients or clients and families and communities. And then, of course, in interprofessional education, we need to bear in mind that leadership is needed. So one of the advantage of the nursing program in our university or in the Philippines somehow is we have a specific subject intended for nursing leadership and management, wherein we can train or we can train our students in playing the role of a staff nurse or a head nurse, as well as future clinical instructors. So somehow that is an edge for them to be trained to how to become future leaders in the near future. So with that, the leadership teams somehow in IPE should work alongside healthcare teams. They need to embrace it because it is primarily the requirement of health professional practice, because this will serve as the key to delivering good healthcare, which is one of the goals of the interprofessional education. Okay, so how do we develop interprofessional competency, which is one of the things that we also need to know. And going back to what I have said, the learning goal for interprofessional education for the interprofessional competency to be developed is to establish an effective collaboration for the improvement of health outcomes of the clientele or the patient, as well as to develop the leadership between and among the team, which composed of the different students from different disciplines. So here in the interprofessional education, there are so many frameworks that we can adapt, but specifically for this discussion, I have adapted a specific framework which is related to the Canadian Interprofessional Health Collaborative, as well as the framework for Interprofessional Education Collaborative in 2016. So the other one in terms of Canadian Interprofessional Health Collaborative is issued in 2010. So to sum it up, both the framework that I have adopted is they have developed at least 5 core competencies for interprofessional education. So specifically, sorry for that sound because our university is nearby the hospital, which is the center for COVID. But we're fine actually. So going back to our discussion, as I have mentioned, from the interprofessional competency that I have adopted, there is 5 core competencies that we have to consider. We have the role and responsibilities, we have the ethical practice, conflict resolution, as well as communication and collaborative and teamwork. So if you will go along with it, it is somehow considered as essential or very important factor in interprofessional education. So we will go it one by one in terms of the roles and responsibilities of students in interprofessional education. There is no single health profession that is capable of meeting all the patient needs. That's why we need to collaborate with other health professions. So that is to fuel the desire to collaborate. The main goal here is, as I have mentioned a while ago, the keyword, one of the keywords is to collaborate. That's why we need to work with other people or other health professionals or other discipline. So many professionals understand that the more they know about other professional roles, the more they will know how to operate and function as a team. So we cannot separate the fact that there is somehow conflict or tension that may arise in any kind of organization or in any kind of team. Conflict usually arise, but somehow in interprofessional education, this tension or conflict between individuals usually arises from stepping on other shoes. So in planning stage, we need to clear those roles and responsibility, such as what is the role of the nursing student here, medical student, as well as pharmacy student. We need to clear those things, roles and responsibilities, so as to avoid the role blurring and avoiding in terms of stepping in one shoes of the other for the team to work harmoniously. So we need to establish professional relationship, or the what is so-called interprofessional relationship in terms of interprofessional education. So if we will resolve those tension or conflicts within the team somehow, the team as a result of that will somehow resolve these issues and concerns. Because usually that tension that usually pop up during the team engagement is that it could create somehow team dysfunction. So the result also may somehow has created burnout within the team. So we need to somehow, as facilitator, the teacher or the professor need to clear those things in terms of duties and responsibilities or roles and functions within the team of the students. And the role of the facilitator here is very important. So we need also to clear, I would like to emphasize here that we need to clear the boundaries and role descriptions, and we need to assist the students in finding a balance and just to focus on the patient's needs that can reduce many perceived professional boundaries. So to avoid conflict or any tension, those are the things that we need to do in terms of interprofessional education. Another one is ethical practice. So ethical practice within healthcare is classed as the standards of practice and responsibilities professionals hold with their patients and colleagues. Among all those professions, medical related programs or courses, or medical related or healthcare education are the ones who are after the implementation of this ethical practice, because somehow this is considered as the standards of practice in medical professions. So heavily reliant on collaborative or collaboration, we need to have the team practice and moral obligation in terms of health professionals, which is considered as required to make complex ethical decision as a team. Ethical decision because we are handling lives. We are we do not have any chance of committing mistakes, because one mistake could mean life that will be lost anytime. So one of the things that we need to consider is that ethical practice. We need to memorize it not only by means of our mind, but also by means of our heart. So of course there are, since we are in different countries, we have somehow differences in terms of ethical practice. But bottom line, we are following a specific standards, which is the standard of practice related to our profession. Okay, so another one is the conflict resolution. As I have mentioned a while ago, tension arises within the team. But in terms of conflict resolution, usually health professionals are encouraged to actively engage with other professionals and patients in a positive manner. So addressing disagreements in a constructive manner as they arise. We need somehow to take all those comments as positive, in a positive way, because when we take it negatively, we will not learn from that. So conflicts can be resolved by identifying and addressing specific areas of disagreement and by establishing safe environments and structures to express different opinions and viewpoints. So during the planning for interprofessional education, we need to somehow point out to these students or to the member of the team, which are mostly composed of the students and facilitated by the instructor or professor, that we need to accept or address those disagreements. And it doesn't mean that I disagree with you. it means that I don't respect you. So disagreements usually occurs in a team, and somehow, even if it is considered as disagreement, we always learn from that. So we need to take it positively. And that is somehow inculcating that our attitude somehow, as facilitator of the IPE, the attitude of the student should be guided properly for them to be guided in terms of dealing with other people. Because as a medical professional, we need to deal with different kind of people, not only those in the professional field, but also our clientele and our patients. And another thing is communication. So communication is a central concept to many interprofessional frameworks and functioning as the core process through which collaboration occur. Open communication usually lead to better health outcomes and better relationships as well. So when we have this poor information that is transferred from one person to another, which is closely linked to poor, that will be or that may lead to poor patient outcomes. So we need to somehow clear those things in terms of communicating well with other teams or group in the or member of the group. So without proper communication, this would lead to harm the patient. So we need also to be open-minded that we need always to think about the welfare of our clientele and patients, as well as the welfare of the team, of course. So communication exists within individual group and levels, and it occurs in both formal and informal. When we speak of communication, we can communicate formally and informally. When we speak of formal communication, it is in the form of meetings, as well as those using the patient records, as well as by means of issuing memorandums or letters, specifically in conducting meetings for the team. But somehow in terms of the what we so-called informal communication that takes place usually during the the usual everyday routine that we have. In the hospital setting, we usually do the communication by means of tools such as ISBAR or ISBAR. So this is usually designed for clinical handover. When we speak of clinical handover, that is you are turning over the patient to another group members or group of nurses who will take care for another period of time. Because in nursing, we usually have the shift or different shifts in having the clinical duty. In the Philippines, we have the 7 to 3, 7 a.m. to 3 p.m. and then 3 p.m. to 11 p.m. and then 11 p.m. to 7 a.m. So we have usually 3 shifts in a day for 24 hours. So different teams or group members of nurses are being assigned on those shifts. So it goes with the students also, and that is during the time that there is no pandemic yet. But nowadays, since we are living in a modern technology wherein we are confined in this kind of communication, which is usually virtual, in the Philippines, we have designed a specific activity for nurses in replacement for their clinical duty, which is the virtual or alternative clinical duty, wherein we created different case scenarios of the patients similar to the hospital. So that is per concept in terms of surgical nursing, medical nursing, OB, pediatric nursing. So those are being given or assigned to the facilitator or clinical instructors who usually handle the students virtually. And then in return, the output of that would be the nursing students should have an output in terms of formulating the nursing care plan as well as drug study. And as final output, they need to present it in front of the panel, which is virtually conducted, to defend somehow or to justify the output that they have created for that specific case scenario. Okay, so another one is in terms of communication. But in terms of communication, skillful communication can enable individuals to overcome differences in terms of opinion and negotiate reaching consensus. In every communication that we have, we always remember, as a team, we need to have the consensus or mutual agreement that we need to agree with each other before we made a final decision or specific intervention for our client. So it is very useful to adjust language as well as terminologies used to suit the intended audience and team members. Questioning should also be adjusted to approach situation from different perspective. We need to adjust language and terminologies because not all, specifically the social work, they are not acquainted with, very much acquainted with the medical terminology. It is good if our or the students belong to our team is considered as medical students or those junior residents or even pharmacists. But somehow in terms of pharmacy, they are very limited also in terms of the medical terminologies that they know. So we need to be adjusted in terms of using of terminologies and other languages. And then for the collaboration and teamwork, which is one of the goals that we need to inculcate to the students in interprofessional education. Collaborative practice is the central component of interprofessional education. So without this, teams cannot effectively function. Learning, which includes regular interactions and interprofessional teams, has been shown to produce positive change in student perceptions towards interprofessional education, regardless of the type of activity. So collaborative practice not only refers to the health professionals working together, but also with the patients and their families, if the setting is community. And that is to provide effective health care for them, that is one of the goals also of the IPE, to improve the health outcomes. So we need to also consider the patient's safety, as I have mentioned, under the ethical practice, as part of recalling that our profession is always have the what we so-called standard of practice. So any deviation from that standard could be considered somehow as unethical. So how would we prepare for interprofessional education for clinical and community settings? So of course, we need to know that in IPE, we can have both formal and informal learning experiences. And IPE as a formal learning should be considered as planned, and the learning experiences should be work towards the goal of developing students the knowledge, skills, and attitude and professional behaviors. When we speak of formal learning experience, we are talking about here that it is considered as structured and were planned, as I have mentioned. That is somehow to develop the attitudes or the KSA that I'm talking about here, which is knowledge, skills, and attitude for the beginning nursing students. Professional behavior should be inculcated to them. So these are actually the most beneficial for beginning student nurses or those collaborated with the nursing discipline. So with that, the scaffold learning is being met. And when we speak of scaffolding in learning, we mean that the teacher or the professor offers a particular kind of support to students as they need to learn to develop a new concept of skill. And with scaffolding approach, we need to know that as facilitator or teacher, we need to share new information to demonstrate how to solve a specific problem depending on the case of the patient that we are handling. And with this, the students might work together in small groups or help each other to solve the specific problem. Say, for example, in case study, if we are focusing on a specific problem or specific case like appendicitis, when we collaborate, in terms of interprofessional education, if we involve 2 or more member of the team there, we have, say for example, nursing, medical students or those interns in junior years, as well as pharmacy or pharmacy student. As mentioned before, we need to clear those roles. So what is the role of nursing or student nurses in taking care of patient with appendicitis? What is the role of medicine students or junior residents in taking care of the patient with appendicitis? What is the role of the pharmacy student or pharmacist student in handling patients like this case, which is specifically focusing on appendicitis? So basically, when we speak of that in terms of interprofessional education, nurses are in charge for nursing interventions. That is also how to carry out orders from the physician's order. So if we need to do such interventions, like if the patient with appendicitis is having a fever, we need to do nursing intervention. So what is the role of pharmacy student there? Our last thing that we need to do is to give medication for the patient. So the pharmacy student should know or should collaborate with the team and explain to the team that this specific medicine or paracetamol has something to do with the fever. And although nurses know that paracetamol is one of the things that we need to be given to the patient when there is a fever, the pharmacy student should elaborate somehow what are the effects and side effects or action of that medication for that specific patient. And somehow the medical student or junior resident who is assigned for that patient as a member of the team for interprofessional education should focus on the pathophysiology of the case itself. So those are the things that we need to consider, that they have a specific role to play in terms of their roles. And that is somehow formal learning experience, because they could exchange different ideas and learning experiences based on the perspective of those students with different disciplines. And it I think when it comes to that, which is considered as collaborative effort in treating patient with appendicitis, is that, or suffering from appendicitis, is that it will somehow, since it will be handled holistically, the outcome would be considered as having met, or we met that outcome successfully, those intended goal, because the team worked collaboratively. Okay, so in terms of the preparation for the interprofessional education for clinical and community settings, facilitators needs to adjust, of course, the teaching strategies to interact and direct students learning for different professions. And here we will consider the uni-professional versus the interprofessional activities. So going back to on how to design or how to prepare the interprofessional education for clinical and community settings, we need to design it very well in terms of interprofessional activities, and we need to construct the alignment of those activities in terms of its discipline, that I have, like what I have mentioned a while ago, in terms of nursing, medicine, and pharmacy. This alignment somehow ensures learning outcomes that are directly aligned with activity. And somehow we need to design also assessment tasks for us to measure if the interprofessional education that we are doing is or has an impact or created learning experiences to the students. So this must be made evident to the participating students at the start of the activity. Facilitating interprofessional groups of students is similar in theory and practice, but somehow it is a bit difficult in the actual field of nursing or actual field or hospital or community setting. So this should be focused on interprofessional approach, not only uniprofessional groups of students in terms of designing the activity. So however, in terms of the facilitators, we need to adjust our teaching strategies as instructor or professor. That is to interact and directly interact with the students learning to different professions. So which means that it requires more rigorous preparation on the part of, actually it is not only preparation, but rigorous preparation and guidance to the students within the member or team, member of the team. When we speak of the uni-professional versus interprofessional activities, here it is, we need to compare the students' group activities. We need to consider 6 concerns and issues. One is environment. So for uniprofessional and interprofessional student group, we have usually almost the same in terms of various settings. We have here the lecture theaters, classroom, clinical settings, information, as well as conversation. It is omitted maybe here the simulation, which is usually have the same or similar simulation strategies or activity with other related medical related professionals. In terms of team dynamics, in uni-professional student group, it is the student somehow established pre-existing relationship with their co-students because they are in the similar field of expertise or field of education, and somehow they have similar understanding or similar knowledge or levels of skills. But in terms of interprofessional group of students, through interprofessional education, we somehow need to establish good communication skills, because here, since we have several group members in a team, in terms of IPE, miscommunication may occur, just what I have mentioned in my previous discussion. So the terminology involved, like what I have mentioned a while ago, that the common or the knowledge or language should be adjusted, or terminologies used should be adjusted for the group or the whole group members to be acquainted or learn from each other. So there is also a possibility of hierarchical issues in terms of, oh, I am the representative from the medical field, so I am ahead of you. I will become the leader of this group. So that hierarchical issues should be polished or should be explained to the students that as students, whether you are a member of the medical field, of the nursing field, or discipline, or pharmacy, you are or you have an equal rights or opportunity to give your opinion, to give your intervention with different duties and responsibilities to perform. And that is somehow to avoid the blurring of responsibilities that I have mentioned a while ago. Another one is grouping. So in uni-professional student group, they group usually according to experience, whether it is mixed or random grouping. And oftenly, there is a predetermined grouping by the facilitator, which is usually preferred by the instructor or the what we so-called professor. So here in grouping, it is the facilitator or the teacher or the professor for uni-professional that is being followed usually. But case-to-case basis or depending on the strategy of the teacher or the professor, usually there are some instances that it is the students who decided who are or who will they choose as part of the member. But in interprofessional student group, here we need to ensure the mixed group of students, that there is not purely nursing from nursing discipline, but usually it should be mixed in terms of there is a representative from social work, if it is possible, if there is someone who come from the field of social work, medicine, pharmacy, pulmonologist in terms of pulmonary therapist somehow. So that mix of student group usually, if it is handled properly by the facilitator, is would have a great result in terms of the patient outcome. But somehow, when we speak of interprofessional student group, in grouping, there should also be a specific facilitator from that different group, because we need somehow to accept or determine that as nurses, if I am the facilitator for nursing students, my expertise will revolve within the nursing discipline, not in medicine, not in pharmacy. So group of students from medicine and from pharmacy should also have their own facilitators. And then those facilitators from different groups should have open communication for them to work out if there are some conflicts that may arise within the students that somehow we cannot be avoided. So we need to troubleshoot somehow, because as facilitators, we need, as I have mentioned, we need to inculcate to the students that professional behavior or relationship must be promoted. So in terms of facilitators, as I have mentioned a while ago, we will serve here as facilitator, not a lecturer. So oftenly, in terms of nursing discipline or nursing education, we usually educate nursing students and focusing on our discipline. But in interprofessional student group, there should also be considered as facilitators on those different disciplines. And that is usually congruent with the groupings that I have mentioned a while ago. For the activity design, should be planned well, as I have always mentioned from the first part of my discussion, because as facilitators, we need to consider that there is different member of the team. So we just don't need to focus on the specific activity of a specific person that is included in the interprofessional education. But in usually the activity for the nursing students, if it is the main member of the group, we need to inculcate or produce a specific activity for nursing students, collaborating with other disciplines, specifically for the facilitators. And actually, guys, this depends. This activity design depends on the discipline that we have, and then the collaborators will talk, or the facilitators. I mean, the facilitators will talk with each other for the smooth flow of the activity. And then, of course, we need to have the assessment, as I have mentioned a while ago, because we do not, or we cannot measure the learning experiences of the students without having this assessment. And when we speak of assessment, yesterday I have heard about the team-based learning as well as the objective structured clinical examination. I guess it is from Taiwan University. And when we speak of TBL or team-based, the last speaker, I guess, that they are focusing on this as part of the interprofessional education. So again, peer assessment somehow is good, but we need to promote positive attitude in accepting those assessment or evaluation of peers, because it is where we can learn to know our weaknesses somehow. Because as a person, we do not know specifically know that this is a weakness, but coming from the member of the team, they can relate to us that you need to enhance the specific skills in terms of communication. You need to establish rapport with the patient, something like that. So this assessment of our peers within the team will help us in improving our knowledge as well as skills. Okay, so how do we facilitate interprofessional education in clinical and community settings? So since somehow trust, we all know that trust develops over time. So we need to be patient in working to the development of interprofessional relationships. Somehow these tips, which are almost 4, should be encouraged between the health professionals that we have in interprofessional education. So having the what we so-called being patient, or being having this wide knowledge or patient with each other just to establish interprofessional relationship is a must that we need to know. And then we need to use students' name, not the role or location. Just like we are teaching with our students that we need to call patients by their name, we need to call the students by their name. Like for example, Miss Gilliasper, if I am the student, not merely talking about, oh, you call the nursing student that is one of the group member, something like that. So we need to, we cannot establish interprofessional relationship if we will not consider calling those members of the team by their names, because as we all know, calling our names is the sweetest thing that we can hear from other people. And then we also consider that disagreement within the team usually occur, as I have mentioned a while ago, but this should not be interpreted as disrespect. We need to be positive in accepting that our disagreement doesn't mean disrespect with one another or with other people. We usually do not defer opinion of other people. We need to hear from them. We need to get feedback from them so that we can improve our performance as healthcare professionals or frontliners itself. And we also need to offer, as as facilitators, we need to offer our skills and knowledge with trust developing through the successes of our students being handled in interprofessional education. So how could we have the what we so-called establishing this respect or interprofessional relationship? We need to inculcate to students how to have confidence, but of course that confidence should have the humility in them, that every time they need to hear a negative feedback, again, we need to accept it in a positive way. Flexibility in managing professional conflict, it talks about the number 3, which is disagreement, or disagreement itself doesn't mean disrespect. So it doesn't mean that I disagree with you, I do not respect you. That is just, this is my opinion. So whether you take it negatively or positively, I need to say this because this may help our team improve. So it is the role of facilitator now, how to polish those issues and concerns in terms of disagreement between the team. Okay, so another thing is, I have here some tips to assist in the facilitation of interprofessional learning and building of positive team function. When we speak of team function, we need to work together. We need to work for everyone to achieve more, which is considered as collaboration and patient outcome or positive patient outcome. So we need to take note of the 10 tips that being given in facilitation of interprofessional learning, building a positive team function. Number 1 is structured early orientation to interprofessional education. When we speak of structured early orientation to interprofessional education, participating earlier in interprofessional education activities, this usually promotes recognition to the need for effective communication within healthcare teams and better prepare students for interprofessional practice. And then another one is role of other professions. So we need to ensure that we have a good understanding of the role of each profession, as I have mentioned a while ago. And questioning is a good thing, but in a nice manner, and we need to accept it in a positive way again and again. So allowing discussion time with the students, guiding them, should elicit somehow answer from the students rather than giving answers to yourself. Like, for example, if the student said that giving paracetamol to the patient a while ago that I have mentioned, which has signs and symptoms of appendicitis, could lower the fever of the patient, which is one of the signs and symptoms of appendicitis. When there is an infection, we know that fever is one of the symptoms of infection. So when we say that, when the students say that, we need to somehow probe the students so that we can extract a good answer, and we could somehow promote the critical thinking skills that they have. So when a specific student with a group team of interprofessional education said a specific answer to the question, follow-up question of the facilitator is that, what evidence supports your claim? So that we can probe somehow, and the students may think of answer and use his or her critical thinking skills in answering that question. So that somehow by means of reasoning, we can train the students in terms of clinical reasoning skills in terms of probing some questions that are related to the topic they are being discussed. Okay. Another one is we need to focus on the needs of the patients, because patients somehow is one of the things that we need to consider in interprofessional education. How can we do that? By means of assisting in the breakdown of hierarchical barriers by focusing on patient needs and patient safety. In healthcare system, one of the important things that we need to consider is the patient, the welfare of the patient, and the safety of the patient. We need to inculcate that to our students within the interprofessional education team. Another one is trust, which is we need to encourage the building of relationship of trust within the team between both the facilitators and the students, and also within student teams. And of course, trust is established through ongoing professional and personal interactions. And this will somehow help in terms of communication. Without open communication, trust will not be exist, or it does not exist without proper communication. So we need to communicate with them, and by means of teaching the students on how to communicate with our patients properly, we'll be able to establish rapport. In the Philippine settings, it is one of our training for the students, initial training for the students is to formulate questions for the patient on how to establish rapport. And establishing rapport with the patient is, first, we are teaching the students to introduce themselves, what school they are representing, and what is the purpose why they need to have to be there in the hospital. By means of that, by introducing themselves and by saying that I am the student of Nueva Ecija University of Science and Technology, and I will be with you until 3 p.m. of this afternoon. So if you have any thing that you need, please let me know so that I can assist you. So that is how we trained our students somehow for the so that we can build trust between the patient itself as well as the relationship, patient and nurse relationship. Another thing that we need to consider is the flipped classroom as one of the tips in the facilitation of IPE, which is when we speak of flipped classroom approach to interprofessional education, it has many benefits somehow because it encourages a level playing field where all students are provided with same pre-class information and attend class with this assumed knowledge. So this frees up in class time for student-centered learning, where the facilitator is free to support the knowledge and skills being developed among the students. And as facilitator, as one of the number in the tips, being a facilitator, not a lecturer. Because when you are a lecturer, you do the 90% of talking, like what I'm doing right now. But as facilitator, when you are facilitator, you have the only 10% talking and 90% of listening. So you just facilitate when there is some gray areas for the students which are member of the interprofessional education. So you are not a content expert. Bear in mind that as facilitator, we are not a content expert in every discipline. That's why we have the what we so-called specialization. Although we may be more accustomed to delivering content based on our field or specialization, we need to focus on the on facilitating discussion of the students, but not merely talking the entire consultation period. That we have only 30 minutes of consultation period, and that 30 minutes was all consumed by the facilitator. So why not let the group or team talk about what are the things they need to resolve, and then if you saw or if you see that there are some disagreements, you butt in and then facilitate, so that that conflict will not be somehow that conflict between the group of the students should be polished and not become the source of major conflict. Another one is peer teaching, or peer learning, wherein here we are encouraging peer teaching and learning for or between the students, between and among the students. So students are closer to each other in terms of knowledge and skills, and are likely to have a greater understanding than tutors regarding concepts their peers are struggling with. If the nursing students have difficulties in pharmacology, since there is a member of a pharmacy student within the team, they could help each other. If the nursing students have difficulty in pathophysiology, since there is a member of the medical students, which is considered as junior medical intern, so they could somehow learn from each other. And then another one is review and reflect, which is since the interprofessional activities are normally focused on health topic or patient case, students may not realize how much they have learned with each other or with other professions. For this reason, it is recommended that we, as facilitator, need to review and make interprofessional concepts explicit to the end of the class. And that will help the students recognize the outcomes of their achievements. So another thing, or last but not the least, is assessment and feedback, which is, as I have mentioned a while ago, it is very important to know the feedback from the peers and from the other group of people. But we need to somehow develop what is so-called positivity within the group. And then when it comes to assessment, of course, we need to see to it that the assessment is considered as the room for improvement. So there are, of course, some challenges in the IPE facilitation, and based on the slide that I have made on the right lower portion of the screen, you will see the number 1, 2, 3, and that is considered somehow as the facilitator's role. There is a very vital role that the facilitator should portray, because as facilitator, it is central, considered as central in mediating group dynamics. And although team members also have opportunities to influence and diffuse potential issues that may arise in small teams. So facilitators often find it very challenging to support teamwork, as with student-centered learning, as well as in terms of facilitators, it required to support the team and also allow them to work independently. So as facilitator, you need to have this expertise to facilitate, not merely by being the lecturer of the group. So we need to take note that there are common barriers to effective teamwork. And as I mentioned a while ago, we have 4 common barriers to effective teamwork. Number 1 on the right portion of my screen is lack of communication skills. I have emphasized a while ago that communication is one of the key factors that we need to consider in IPE. So we need to express ourselves, we need to communicate ethically and positively, so that we can avoid some tensions and conflicts that arises. Another barrier is that number 2 is different professional culture. We have, as I have mentioned, we are expert in all the field that we have. We are expert in our own little way in our respective field. So we need to respect what is the expertise of each other. Instead of having this dispute, we need to collaborate for us to have what we so-called meeting the outcomes of effective delivery of healthcare. Another one is traditional hierarchies and assumed leadership. Again, in interprofessional education, somehow we are teaching them the leadership functions somehow, and those traditional hierarchies should be avoided or removed slowly, because somehow we need to respect, again, we need to respect each discipline, that every people has their own expertise, and we need to respect that when we do not know a specific situation or case of the patient, we need to be humble to ask some people or the member of the team about the specific problem that we are encountering for that specific patient. Another one is role blurring, which is confusion over boundaries and responsibilities. And I have emphasized that in my previous discussion or in my previous slide, that by means of putting boundaries in terms of duties, responsibilities, roles, and functions of each discipline or member of the team in terms of their health education or program where they belong. If it is nursing program, medical program, or medicine program, or pharmacy program, they have different roles to play. So we need to respect somehow those boundaries, that when we do not that thing in terms of handling patient or the effect or side effect of something, or we do not know the pathophysiology exactly of that patient, we need to have communication, or we need to communicate with the rest of the member of the team to clear those gray areas that we have. So in terms of these key challenges, after those barriers has been discussed or explained, we need to consider that planning IPE activities is very important. I have mentioned it a while ago that the design of the activity could be more effective and better if it is suited to the delivery of interprofessional education. So teaching-based learning or team-based learning actually is one of the effective activities or dynamics that we can promote in the interprofessional education, as mentioned yesterday. And we also have simulation and student-led interprofessional clinics. And particularly in the junior years of the students, team-based learning has the capacity to draw participants' attention to the process of learning, and it has been correlated with encouraging better teamwork skills and improved communication. So it is the thing that we need to focus on. In terms of peer teaching and interprofessional education, within IPE activities, peer teaching provides a form of student interaction. So when there is an interaction, there is a communication. So that interaction usually facilitated within the formal professional context, and there goes the role of the facilitator. So learning in this context somehow, when it comes to peer teaching in IPE, it somehow provides a process of socialization, where the students have the opportunity to share their experiences within their own discipline with students from other disciplines. And IPE activities somehow provide students with opportunities to familiarize themselves with different languages and tasks of each other's profession. So this process contributes to the development of students' own professional identity and their understanding of different professional responsibility. And in terms of the assessment and feedback during IP activities, the provision of accurate as well as timely feedback to learners on their progress towards achievement of IPA outcomes is critical component of health professional education programs. In the Philippines, when you speak of health profession education programs, it is considered as program offerings or Bachelor of Science in Nursing program itself. So it is similar to health professional education programs. So feedback should be seen as an active process, and that emphasizes the agency of the learner as an active seeker of feedback on the basis of which they can improve their performance. So giving and the receiving peer feedback within the interprofessional context can be powerful because this can improve our performance and knowledge as well as skills. The views of health professionals outside of our own discipline is often meaningful, increasing our self-reflection as individual, as well as those multidisciplinary feedback has the ability to promote reflection and communication and the use of terminology. In terms of the evaluation or evaluating the implementation of IPE activities, we need to consider that IPE evaluation and research lacks rigorous design. So it is up to the school how will design the IPE in terms of different approaches or different frameworks.
Excuse me, Ma'am Jean. Is 5 to 10 minutes enough to finish your topics?
Yes, ma'am. I have last 2 slides.
Okay, thank you, Ma'am Jean.
Okay. So these are some of the challenges that we need to, in conclusion, we need to know that IPE is challenging, but it is achievable. Hence, the strategic planning, design, and proper facilitation should be considered, as well as the creation of authentic IPE activities for health professional students. And then adequate training on IPE should be done for a more collaborative undertakings between healthcare teams for patient safety. So IPE in the Philippines somehow has existing challenges because the congruency of the curriculum with other disciplines should be considered. And some universities or schools have limited program offering or courses related to health, just like that I have mentioned for our university. So what are the things that we need to consider is that somehow we need to take into consideration that these takeaways that I have written in my slides or presentation can help us reflect on what are the things we need to develop in the implementation of interprofessional education. So with that, thank you very much for listening. And if you want to collaborate with us, this is my contact number. You can reach me through my email address and through my cell phone number. Thank you very much.
You're very much welcome. Thank you very much for an insightful topic, Ma'am Jean, about the interprofessional education. Thank you.
Thank you, ma'am.
Respected audience of the International Nursing and Health Sciences Conference 2021, allow me to remind you again that if you have any questions, you can write them down in the chat room, or you can address your questions directly when I open the discussion session. Ladies and gentlemen, our next panel speaker is Ajahn Wasana Ruangsenon from Thailand. Allow me to read her curriculum vitae. Assistant Professor Dr. Wasana Ruasenon is the Assistant Professor in Adult Nursing Department in Konkan University, Thailand. Her recent position also as the Director of Master of Nursing Science in the International Program. Ajahn Wasana gained her Master of Science in Nursing in 1999 as the Cardiovascular Clinical Nurse Specialist from the University of California, San Francisco, United States of America. And in 2003, she gained her Doctor of Philosophy in Nursing from the University of Washington, Seattle, USA. In 2006, she joined a short course training on nurse practitioner program at the Faculty of Nursing, Konkan University, Thailand. And 5 years later, in 2011, she joined the short course training on research-based learning at Konkan University and University of Queensland, Australia. Our second speaker has very long achievement in her CV. In the research field, her recent research project, she holds a position as the co-investigator in the research study entitled Development of the Healthy Organization in Faculty of Nursing, Konkan University. It was a grant research study given by the Thai Health Promotion Foundation. She also holds a position as a co-investigator in the study of development of healthcare workers, competency in preventing ventilator-associated pneumonia according to the existing protocol in one community hospital, a study granted by the research grants for novice researchers in Konkan University. Ajahn Wasana also has quite a lot of publication, including textbooks and research articles. Her textbooks was published in 2011 with the title Nursing Care for Patients with Cardiovascular Disorder. And her recent publications in 2021 was published in Nursing Science Journal of Thailand with the title Predictors of Fluid Retention Prevention Behavior Among Patients with Heart Failure. Another publication which was published in Thai Red Cross Nursing Journal in 2021 with the title The Development of Case Management Needs Assessment Tool for Patients with Heart Failure. And she has many more publications as well as awards and honor from the Thai government. This is her full curriculum vitae. As you can see, it's quite long CV pages. Yeah. But before she starts her presentations, I will invite our respected speaker, Ajahn Wasana Ruasenon, to deliver her topic through a video recording. Ajahn Wasana, the stage and time is yours. Thank you.
Thank you, Buddy.
Saan po tayo or sa sweet baker ulit?
Ano ba meron sa sweet baker?
Yung yun din ma'am, yung nasa...
Ano pa hindi natin na-order doon?
while we're waiting for the committee to prepare the topics from Ajahn Wasana, allow me to read some of the questions. Apparently, the audience of this conference has had 2 questions for Prof. Jin. Yeah, for Ma'am Jin. Allow me to read it for you, Ma'am Jin. Perhaps you can answer when we open the discussion session.
Yes,
So
ma'am.
the first question is, could you please explain to assist facilitation of interprofessional learning? We have to be how we have to be a facilitator, not to be a lecturer. How can you explain in such situation? Sometimes it's hard for us to resist lecturing our students when they are misleading, when they are doing their practice in the interprofessional education. Like, can you give us some topics, tips that how we can increase our roles as the facilitator, not as a lecturer in this particular learning process? That is the first question. And we also have another question, apparently. Thank you, Prof. Jin, for sharing about the interprofessional education with us. I want to ask one question about the facilitator who has to adjust to the teaching strategy. Can you share to us about the best teaching strategy in IPE based on NUFA ACH University Science and Technology experience? I mean, we believe that you have quite some experience in conducting the IPE for your nursing students in NUST, and we would like to hear further about your experience in collaborating with other faculties, for example, medicine, pharmacy, or other health science program. So those are 2 questions from us for the meantime, Ma'am Jin. Yeah, perhaps
Hello,
we hope you
everyone.
can answer
Sawadee
to those 2
My name is
questions when we
Wasana
open the discussion session. Yeah, thank you, Ma'am Jin. And at the moment, we're going to have our second speaker to deliver the next topic for our respected audience. Thank you.
Hello, everyone. Sawadee ka. My name is Wasana Roysungneun. I'm the director of the Master of Nursing Science International Program at Faculty of Nursing, Khon Kaen University. Khon Kaen University is the largest university in the northeast of Thailand in terms of its geographical areas and also in terms of the numbers of students and faculties and college in our universities. We have 19 faculties and colleges in Khon Kaen University, or KKU, which is divided into 3 groups. The groups of science and technologies, which within that field, there are 5 faculties. And the groups of health science, which belong to 7 faculties, and also the fields of humanities and social science, in which we have 7 faculties altogether. In addition to that, we have 2 colleges of interdisciplinary science, which is the International College and also the Interdisciplinary Science at Nong Khai campus. So the experience that I will share with you today regarding the interprofessional education development in Thailand is from my experience when I was working as the Associate Dean for Academic Affairs and also the Associate Dean for Student Development Affairs in our faculties. So let me start from the larger pictures of IPE in nursing education in Thailand. So my presentation will be around the context of what has been changed in our healthcare systems regarding the complexity of the system of care and also the health problem among Thai people. And I think it happens around the world, not only in Thailand, that leading to the transition in the educational policy that need to be addressed, the multidisciplinary care, so that the design of our curriculum and study program that right now we are using the OBE, which stands for the outcome-based educations. And I think many institutions in Thailand right now already use the OBE. So the expectation of the student competency within the curriculum program right now also focus on the interprofessional education as well. So students need to learn with other professions and also to be able to work as a team member of the group. And also my presentation will also include the extracurricular activities that we provided for our students so that they can we can promote their professional working environment and capacities. So let me start from the context of IPE in the world or in the global, that actually originated by WHO, World Health Organization, in 2010. So it's not a new issue. Actually, it is the ongoing strategies that it is addressed within the framework in the name of the framework of action on interprofessional education and collaborative practice. So these frameworks make recognition that the healthcare system around the world had faced with the fragmented service, and whereas at the same time the complexity of the healthcare system and health problem is increasing. So the collaborative practice is necessary at this time that addressed by WHO. So the framework also indicate the collaborative practice ready as a strategies by which the healthcare personnel receive the effective training using IPE approach. So according to this framework, the IPE will happen when the student from at least 2 different disciplines learning together and understand each other. So that will be the way to promote the collaborative works after they graduate. So from that, the beginning of the WHO framework, therefore the Thai National Health Assembly in response to that has approved the National Strategic Plan to develop the health workforce education for the 21st century. So this plan has been developed during 2014 and to 2018, and after that it was produced and then make public understanding about this framework. And the National Commission moved this strategic plan on participatory and voluntary actions that the understanding among 9 health professional organizations working together under this framework, and nursing is one among that professionals team. So from the beginning, the Committee on IPE was constituted by the National Commissions to implement the IPE strategies in Thailand. We based this strategy on WHO frameworks. So the IPE is expected to bring about the effective collaborations and improving the health outcome within Thailand. The national strategy include the development of the IPE guideline, in which I will talk about that later, and then the promotion of the reform and policies advocacies among people who take part in the policy making. And in addition to that, the capacity of the leadership and also how to evaluate the IPE programs also was developed at that time as well. And lastly, the research on and collaboration of the IPE practice is another aim of this commission work. Within this Thailand IPE guideline that was published in 2018, including in this guideline is the competency domains in which the healthcare institution that would like to implement the IPE program need to understand at least 5 necessary domains of the competencies that the program or the curriculum should integrate into the program. The first competency domain is the domain about ethics and shared values. The second one is the roles and responsibilities. And the third one, teamwork and leadership. Fourth one is learning and reflection. And lastly, the interprofessional communication. Including in this model is in this guideline is the example of the modules that the institutions and any college or universities that's teaching on healthcare science can use as the example. Like module 1 is the One Health module, module 2 is the collaboration and partnership module, something like that. So the organization that support this guideline development and distribution of this guideline is the Thai Health Foundation, which is the largest government health foundation in Thailand. And it is under the care of the Prime Minister of Thailand. Within this framework, there are instructions of how to develop the IPE curriculum, how to teach using IPE, and how to evaluate the outcome of the IPE graduates. The scope of this guideline, that as I mentioned earlier, that this will cover 5 domains. So in the first competency domain is the ethics and shared values domain. Within this competency that use the abbreviation of EVE, it is emphasizing the importance of how to adopt and how to maintain the mutual respect and share values in the professional working environments. The second one is the competencies in roles and responsibility that they use the RR as the abbreviations. So the RR emphasize on the abilities of the student in the IPE program to apply knowledge of each profession and interprofessional roles and responsibility in order to assess and also to address healthcare needs of the specified clients. The first competency is teamwork and leadership, or TL. These competencies makes use of how to create the professional relationship and also the teamwork dynamics to provide care from different roles in order to achieve the safe, timely, and efficient outcomes of the clients. Number 4, the competency domain of learning and reflection, or the LR. For this domain is focused on the ability or the competency to be aware and describe and act in the way that allows oneself to close the gap between what they already know and what they need to know. And lastly, but most importantly from my point of view, is the interprofessional communication, or the ICs. So the terms itself, or the name of this competency itself, indicates the aims of this competency is that to promote the ability to communicate with the healthcare team, with the multidisciplinary team, and with the clients, and also the families of the clients, in order to achieve the appropriate outcomes of the IPE practice. So let's see the example of the learning module within this guideline. As I mentioned at the beginning, that we right now using the OPE approach. So what you will see in here is the format of the OBE, which is within the EV, or ethics and share value. It guides how to use the teaching and learning methodology or strategies to produce that outcome. And then what kind of assessment methods the instructor or teacher can use or may use to evaluate that expected outcome of this module. So in this guideline for 5 domains, they will have the example of actually 5 competency domains. And also the example of the learning module, as I show in the earlier slides, that there are example of learning module. So in this module, there are different time delegates for students to learn. It depends on how many contents are there in each module and how many expected outcomes that teacher should be expected from that learning module. So for example, this module 2, which is the collaboration and partnership modules, students will take approximately 120 hours to complete this module. Okay, and actually it guides in this module is guide how to develop or initiate the learning materials for students to learn in order to achieve the outcome of this module. Okay, so that's the example of the guideline that developed by this group of people, come from different disciplines, including medicines, pharmacies, nurse, and also other disciplines in healthcare science. And that's also including the Thai applied health care or applied medicines, Thai applied medicines. So the example of the course specification will look something like this, which is, I think this probably the standard type of the course specification that we use in all universities and educational institutes in Thailand, that we need to have the university name and the department of the program that is developed, and also the name of the courses under this program and the credit of each course, something like that. So that would be the example of the Thai IPE guideline that developed from 2018, and it has been used until now, but I'm not quite sure that how many institutes right now that follow this guideline to develop their own programs, because it's not mandatory, it's just the guideline to be useful guidance institute to be used. And from that effort to make more understanding about IPE practice and IPE education in Thailand, this same group of the commission has produced the new journal. It's called Health Workforce Education Journal. It is indexed in Thai Journal or TCI, which is the first issue hasn't been published yet. That's quite new journal. In this journal, there are a group of editorial boards that come from several disciplines in healthcare. And the first issue will call for submission on interprofessional education. So if you have any research or any academic paper that you would like to submit, you can also submit to this journal. And because it is just a new journal, the impact factor hasn't been published in this journal yet. It is the open access online journal, and it is a peer-reviewed journal on interprofessional education and collaborative practice. So I hope that in the future, when we have conducted more and more research on interprofessional education, this journal will be one of the high quality journal in Thailand, probably. Now let's move into the closer perspective of what I have my own experience in KKU. So within KKU, as I mentioned earlier, that we have so many faculties. We have 19 faculties altogether, and we have several discipline areas in here. So in terms of trying to adopt the IPE approach within our campus, we do both the class activities and the extracurricular activities to promote the IPE approach among our students. Let's start from the very long time developing this course. Is called Community Medicine in KKU. And we have like the short term or short name for this course as a COMMET. This COMMET course is the undergraduate course that focuses on the community health projects. And it is organized by the Faculty of Medicine. It's open for students to register for the first time in 1983, which is many years ago. And it's a collaboration between Faculty of Medicine and Faculty of Public Health at that time. Later on, many health science faculties took part in this course, and including Faculty of Nursing. So Faculty of Nursing, Faculty of Medical Associated Science, Faculty of Dentistry, Faculty of Public Health, and also Faculty of Medicine took part in this course. It is now one of the best practice of the IPE courses in KKU. But right now we also have another member of institute who take part in this course is the College of Asia Nursing Scholars that also register in this course as well. Because it has a long-term history for this course, therefore, if you search in the internet putting the term COMMIT or Community Medicine KKU, you will see that there are the link is to outside the websites showing the activities video in YouTube channel and also the lesson learned from each time of the field works that student did the activities. Right? So you can see like the guideline of the teacher who teach in this course, the activities that the student learn in this course as well. So it is one of the IPE course in KKU campus. Within this course, students from several faculties, they did activities together in order to promote health of lay people in the community. Most of the activity involve using the local wisdom to promote healthcare within that community. So it's like give and take course in which students provide knowledge and skill practice for people in the community, but also people in the community give back something that is the local wisdom for the student to learn as well. I used to be a part of teaching in this course for many years ago when I was working as the assistant dean for student development, and I took my students from Faculty of Nursing to do the activities in the communities, and I have learned it myself that to get involved in this course, we learn a lot. We learn from students who participate in the community setting and community context. We learn how people make use of the local wisdom, but also we help our students learn how to do the volunteer works within the community, like the part of community that look at their own health problem, which is so different from what we views their health problem. So in taking part of that activities, is not only learning each other, but is also make the student learn how to understand students from other discipline or other faculties, that what the expectation of the curriculum from each discipline are not the same, and the roles and responsibilities of each discipline are not the same, although they are in the same healthcare faculties, but they can understand their own self when they work with students from other disciplines, that they look at the same problem with the different worldviews. That's the opportunity for our students to learn as the member of the team. They can take turn to be the leaders and to be the members. They know how to make the environment of working together more effective and more efficient. Also, the challenge of teaching in this course is that we have to make a very good plan, especially to go into the community, do the community survey in advance, and then we have to talk with the community leaders. So every year that this course open for students to learn, we cannot go to the same community again and again and again, because the health problem will be similar to students from the earlier years that already took this course. Therefore, we need to have many networking community that students can go in the different years. And also, what is the most challenges part of making this course successful is that find the right time for everyone to get involved, because students from different faculties, they might have the time frame for their study program differently. Therefore, right now, Faculty of Nursing cannot fit themselves into the timeline of this course offer any longer. So we right now cannot be a part of this course anymore. That's hard, this kind of hard, because the years of the student, the program that has changed after every 5 years, that we have to renew our program, and that when the time of this program doesn't fit with the program of the student study, so we have to make a decision whether or not, although this make a great use of learning for our students, but we no longer be a part of this course anymore. Another experience that I have with at the university level in terms of extracurricular activities is this project. It is called the mHealth Thailand Bootcamp and Hackathon. The hackathon come from these two terms, hack plus marathon. So in this project, it is the collaboration between the MIT Center and the staff from Harvard Medical School from the United States that support this project. It's called the KKU Bootcamp. So the concept of this project is bringing together innovators to co-create the digital solutions for health issue in Thailand. So it happened in 2017 for 1 week in January within our campus, and we also get support from True, which is the big mobile agency or mobile company in Thailand. And what students do in this project is that the participants were students from two large groups. First group is the student from health science faculties, and as I mentioned at the beginning, we have 7 faculties belong to health science group. So a student from these 7 faculties will need to be in the match group, and plus with one of the students from, at least one of the students from the group of IT or digital or design as the participant in the team. So it will need to be at least students from these 2 groups together. And when they team up already, then they need to submit the application form. So in this application form, this is the example of the application form Faculty of Nursing. They will need to address the name of the project that they would like to do, and they have to write the background and significance of this problem, of why they would like to do this project. And then they have to sell the ideas of this problem and this project to get the match partner. So the first originate participation is the health side from the health side side. when they sell the idea about the problem, and then students form another side, which is the IT and design team, will make a decision whether or not to buy that idea. And then we sell and buy the idea already, and they get the team already. What they need to do next is to plan and decide together in the camp. So they have to spend the whole week in the camp together. After that, they get the product of innovation. So develop together and they test the product within 1 week. And then what they do next is the presentation together, and the referee are the administration board, KKU administration board, and also the team from Sena and team from Harvard from the United States. So they have to present in English, and then you answer the question and the feasibility that this project can be used for real. So before they sell the idea, when they submit the application, one of the things that the founder of this project have to ask them to understand is that this project will open for public use, which means that if the idea would like to be used for commercialized purpose or to be patents protected, they cannot doing that in this project because is expected to be used by public. And after that, when they do the presentation, they can win the prize. So there were, if I remember correctly, 3 big prize for the winners. So in this project, students learn to work with students from other faculty members for real. So they have to share the idea, they have to listen to team members, and then they have to try to motivate each other with the evidence that they found with the reasons or the rationale that they have. So I think students learn a big deal from these projects. And that another type of IPE, which is the extracurricular activity provided from the university at the university level. Now let's move a little bit closer to our faculties. In the Faculty of Nursing, ourselves also have both academic and student development activity, which is the extracurricular activities that employ the IPE approach as well. The course that we open for students in undergraduate level, and I think this course is about 8 or 9 years ago already that we have this in our undergraduate program, is called Nursing Innovation Projects. So in this course, we hope that our students learn to identify health-related problems in their interested population. And also we hope that they develop the nursing innovation to solve that problems. It used to be the course open for 4th years nursing students, so it's the last year as in the life of undergraduate studies. But right now we move it to the 3rd year because of the evaluation from the former group of students saying that doing in 1 semester only is too short for them to evaluate the outcome of this innovation. Therefore, right now we start at the 3rd year of the program. So students form the team within this course, about 10 to 12 students in one group. And then they work together by identifying the health problem in their target population. And each group will get advisors, which is a faculty member in our faculties. So faculty members from every department in Faculty of Nursing took part in this course. Students who work with faculty supervisors from pediatric department they might develop innovation in pediatrics nursing. And students who work with adult nursing department, they might do the innovation for adult population, something like that. So when they get assignment of the supervisors already, then they have to search for the problem that they would like to develop innovation projects. And after that, when they get the decision in the group already of what innovation they would like to develop, then the next step is looking for the partner to help them develop this innovation, which can be students from all of these faculty, including Faculty of Fine Art, Faculty of Engineering, Faculty of Architecture, and normally within this faculty is the Department of Industrial Design, that they have many contact with students in this school. And also Faculty of Pharmacy and Faculty of Medicine sometimes. Not only students from this faculty that get involved in this course, but also we'll have the teaching staff from other faculty members get involved in terms of giving consultation and giving suggestion, and also being the expert of innovation development as well. Like in this photo, when my student in this group would like to develop this model of teaching for hypertension and blood pressure control, after they do the interview with the nurse in this hypertension clinic, saying that the conventional way of teaching hypertension and blood pressure control is not quite effective enough. So the doctor, the physician who work in this clinic also would like to take part in this project by giving guidance to students and giving the consultation for the content that can be used to teach patients within this innovation program. But in order to develop this kind of the statute for teaching, students from Faculty of Nursing cannot do by themselves, so they have to find a partner from Faculty of Fine Arts and also from Faculty of Engineering to work with them in order to create this model for teaching, something like that. And also teachers from both faculty take part in this project as well. So that's the example of the course activity applying the IPE approach in our faculties. And here is the show and share. After they finish developing the innovation, they have to test it in the real setting. And then they have to analyze the outcome of the innovation when it is tested. Then they have to produce the poster and also have to show all of the work from the project. And then the faculty members who get involved in this course will visit all the project and then give the score. After that, they will get the grade from all faculty members. We also invite teachers from other faculties and also the university boards, administration board to take part in the show and share day, and in which they can visit and like give the comments to the student and give the score to win the prize. And that's not the grade. The grade only comes from teacher who teach in this course, but the score to get the prize or the rewards come from the outsiders, faculty member from other faculties and also the university board who come to visit in that show and share day. So it's like the big events for them to finish this coursework in the program. So I think this is one of the exciting day for both students and teachers who teach in this course as well, because they prepare for a long time, and then they also invite their friends from other faculty who get involved in this course to visit on that day as well. And not only in the course activity like that, but also in terms of teaching in the clinic. We also collaborate with other healthcare professions who work in the clinical setting in terms of teaching our students as well. So in these photos, we have medical associated technicians who work in the hospital, and also we have the medical therapists, physical therapists. We also have the physicians help teaching our students when we have the clinical practicums, and we do that for a long time. And I think this is one of the IPE activity that they can learn from other disciplines. And for the graduate level as well, when we have the course such as health science course, teacher who teach in that course are not only teacher from nursing faculties, but we also get invited teachers from Faculty of Medicine and teacher from Faculty of Pharmacy to teach in the course as well, because students have to learn about medication and how to get advices for clients to use that medications. And also we invite the physician in the related fields to teach in the course as well. So I think that is one of the approach, IPE approach in our faculties that we have been using for quite a while.
Let me show with you this short video presentation that made by this group of our students. They were students from third year in the undergraduate program. That is the time when I was working as the associate dean for student development affairs, when one of our students brought up his idea that he would like to invite his friends to do volunteer works in his village that was affected by flooding a year ago. And then it was one summer that they didn't have any coursework during that summer. So he would like to invite friends from Faculty of Nursing and other faculties with the support from Faculty of Nursing in terms of budget to do this work for the community. So I and my team acknowledge that because KKU mission, one of the KKU mission is the social devotion, and that's also a part of Faculty of Nursing mission as well. So we were happy to support them by giving consultation, suggestions, and then budget support. So this group of students go together to the community, they plan together, and then they get it done. Let's see this short video presentation. This was a great example of IPE approach that we were very proud of them, because they did almost everything by themselves. We and other faculty members only gave them support and consultation when they need, and serve as a budget support or other works. They get it done by themselves with a great teamwork. And the evaluation of the project came out that community members were very appreciative of what they did, and every team member can spend their own expertise. For example, faculty of architectures can use their knowledge and skills to change the environmental context of the community to make it better. And a student from faculty of dentistry provide oral health and oral health care, and also giving the information for students actually in the community to take care of their teeth and oral health. And students from faculty of nursing giving the health promotion project, and also to help them screening health problem. So I think this is a good example of IPE, extracurricular activity approach.
And the last example that I would like to share with you today is the IPE workshop between KKU and the Kanagawa University of Health Services. And this workshops is the graduate students workshop that just recently that we as a team get contact from faculty members from KUSH. Professor Shinji Nakahara, he is a good friend for a long time because he come to Khon quite often because we have his research project with Khon Hospital. And then I met with him at Khon Hospital. He shared this idea that he would like to develop the workshop between the student that he was teaching in the program, and he invite students from Faculty of Nursing and other faculties in Thailand. So, and in this workshop, there are also students from Faculty of Architecture, and then we have students from Faculty of Health Services in KUSH and Faculty of Nursing to get involved. So this workshop is a joint workshop about transportation and health communication. So Professor Nakahara himself has his specialty area in traffic accident and traffic injuries. So how to change people transportation behavior in order to reduce injuries related to traffic. So in this workshop is a five-time series workshop in which students get to learn from faculty members from both sides actually, but mostly from Japan side, that teaching about health communication and transportation safety. So they get lectures and they get to learn about theories that can be applied in the project. And then students from these three groups, from Faculty of Nursing, Faculty of Architecture, and from Japan, have to team up and then develop a project in order to reduce the traffic injuries together. So within that workshops, after they get the lectures already, then they have to share the idea about the traffic situation both in Thailand and in Japan in order to share and learn from each other. And then they will pick the situation in Thailand, especially in KKU campus, for the incident to develop the project. And after that, they work together on bi-weekly basis. After get the lecture already, then they break out into the small group discussion, and then they work together to develop a plan for the project. But
because the time for this workshop is quite short, because students from Japan, they have to work on that working time. They so student while they were also working, and students from Thailand, they work on their thesis right now, so they cannot spend too much time working on this workshop. Therefore, it is just a plan, not the real project that implement in the setting yet. But finally, at the end of this workshop, the group of students, there were 4 groups of students, and in each group of students do a presentation of their project at the end. And what included in that project is that the plan how to evaluate the successful outcome of the project. And then we do the competition, and students get the prize at the end of this project from the referee of both sides. So it is a good project, and we think that we will continue to do this project together in order to make our students share and learn together as the IPE work. So this is the outcome of this project, in which at the end there will be like 4 groups, 4 projects, and then teachers put together on this project into this conference paper, and then one of the students will be a representative of this group to present this workshop in the academic conference. So that will be the outcome. And right now the paper is in the way of publication, but it is in Japan language. So hopefully it gets published soon as a result of this IPE work. In conclusion to my presentation, I would like to share with you the lessons that I have learned from IPE involvement so far. I think one of the things that I have learned is that to develop the international IPE language can be a barrier, because it takes time for them to understand when they communicate, if they communicate in other language more than in addition to their mother tongue language. And then the other things that I have learned is that cultural differences can be both pros and cons. I look at it as a pro because I think that they learn a great deal from different cultures of how people acknowledge cultures and the things that happen in their life. But then it can be a con side as well when they try to understand some of the reactions or some of the response from their peers from different cultures that they don't understand the background. So it can be pros and cons from my point of view. The other things is that in terms of teachers or instructors that get involved in the IPE, and also from the student themselves as well, if they are a person who have a network and collaborations in a wide range or wide variety across the discipline, that can benefit the IPE approach a great deal. But if they know not so many people, that can be barriers for IPE approach as well in terms of making a network. And because I took part in both extracurricular activities and curriculum-based activity for IPE, so I think that to make it more sustainable, the approach should be a curriculum-based, because it is like mandatory. Students ask or have to do it because of the requirement. But it is more fun and more livelier for students to learn if it is the extracurricular activity, just as in the video that I show. So they will show more skills in terms of leadership and then partnership in the extracurricular activity. So I think we need both curriculum-based activity and extracurricular activity in order to promote a good IPE approach in the program. And I think the contributions from various parts of the organization or agencies is very important to have a successful IPE. For example, from the project that get involved at the university level that get involved by Harvard University and by Sana and through telecompany. So that because some of the activities in the IPE approach, it need technical support and also need the monetary support. So contribution from that part can make a big successful IPE approach. And I think last but not least, to adopt successful on sustainable IPE education approach, it needs time and a good plan to develop. So so far, I think we are in the beginning stage of IPE in Thailand, but I look forward to a more sustainable and more official IPE approach in our country. In closing to my presentation today, I would like to extend my appreciation and thankfulness to International Nursing and Health Science Committee at Universitas of Muhammadiyah Purwokerto for inviting me and giving me a chance to share with you my IPE experience today. If you have any questions or comments, please send all that you have to Ms. Maida and she will forward that to me. I will be very happy to answer any question that you have for today. Thank you very much again. Sawadee.
Sawadee, Ajahn. Thank you very much. That was our second speaker. Ladies and gentlemen, for the meantime, you can deliver your questions in the chat room for Ajahn Wasana. And we will deliver your questions to her or through Ma'am Maida. Okay, our respected audience of the International Nursing and Health Sciences Conference. Now we're going to have to listen to our third speaker topic. That is from Ibu Umi Solihah. Let me read her curriculum vitae. Associate Professor Dr. Umi Solihah, registered nurse, is the Dean of the Faculty of Health Sciences, Universitas Muhammadiyah Purwokerto. Ibu Umi finished her Bachelor in Nursing from Universitas Gadjah Mada, Indonesia, and she then studied further in her master degree, specifically in pediatric nursing from University of Indonesia. Ibu Umi was also an alumni of doctoral program from the Faculty of Medicine from Universitas Gadjah Mada, Indonesia, and her specific major is in pediatric nursing. Ibu Umi has quite a lot of publications from 2015 until recent year. For example, it has been published in International Journal of Research in Medical Sciences in 2015 regarding the integrated management of childhood illness training needs on cadre for improving family and community capacity in simple handling of respiratory infection, diarrhea, and less nutrition in children. Further research was also published in Indian Journal of Public Health Research and Development. In recent years, she had patent rights with the name of product the Pagen Therapy Pangenu Ferrum and Phajum. Also, she had another patent rights for instrument need analysis of child emergency training for nursing. Regarding her publications, she had published quite a lot of research from 2016 until 2021 and has involved in many national as well as international events, such as in ICOPH, TCD, and then in Asia Pacific Conference Pediatric Nursing, in IRECOMS, and also in International Nursing Student Forum in Guangzhou University, China. Ibu Umi also serves as an editor as well as a reviewer in many national as well as international journals. Okay, ladies and gentlemen, this is the full CV of our third speaker. And without further ado, let's welcome our third speaker, Ibu Umi Solihah. We will give you approximately 45 minutes, Ibu, for delivering your topics. Ibu Umi, the time and stage is yours. Thank you.
Okay, thank you, Mbak Susan. Are clear my voice, Mbak Susan? Okay.
Yes.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. The honorable all presenter today, Dr. Jin, how are you? And Dr. Wasana. Good morning and good day for all participants. Nice to meet you all. I think now you are all hungry and sleepy, but don't sleep, please. Yeah. Okay, I will share screen my presentation. Sorry.
Ibu Umi, do you need our assistance?
Sorry. I can. Okay. You can see our presentation. Sorry.
Yes, but unfortunately, it is not your slides, Ibu Umi.
Okay.
Previously, you have shared the slides that you have.
Okay.
Do you need our assistance to share your topics, Ibu Umi?
No, waiting.
Ibu, you can share, you can start to deliver your topics, Ibu. Ladies and gentlemen, let's wait for a while for Bu Umi preparing her slides. Apparently there is some technical problem. Okay, now she is ready with her slides.
Oh, okay, thank you.
Okay.
Sorry.
Please.
Yeah. Okay, I was asked to talk about opportunities and challenges of interprofessional education in implementation in nursing education. The first slides, APA occurs when students from two more professions learn from one another to enable effective collaboration and improve health outcome. IPA is a necessary step in preparing a collaborative practice ready health focus to respond to local health needs. And maybe in part of concept, the same as the delivered by other presenters, and it's good to better understand what's IPA and compared to implementation in some countries. And IPA learning can be started when students study in college for the purpose of being able to collaborate with other health profession when they work. And then implementation of services in hospital is important to pay attention to medical safety. One of them often occurs medical errors, poor communication between healthcare professionals, inadequate communication with the patient, poor teamwork, inadequate documentation, poor clinical reasons, problem solving and decision making, and poor leadership and management practice. Teamwork, communication, and collaboration between health professionals are important for the safe and effective delivery of healthcare. Poor communication was the most important common factor contributing to medication errors, increase in interprofessional collaboration between doctor, nurse, and pharmacist, sought out therefore reduce the considerable medication related morbidity and mortality. This had to occur collaboration. The collaboration of health worker in hospital include the professions of doctor, nurses, pharmacists, and then radiologists, health information officer, laboratory analysts, physiotherapists, and nutrition and each other. They can handling one case together. It's play a collaborative role for the patient recovery. And opportunities for health serving, strengthening healthcare system, improve the quality of delivered patient care, reducing the cost of care, shortening patient duration of hospital stay, and improving health outcomes. Patient care in health services in hospital and communities require the collaboration of several professions in a comprehensive manner. Good and harmonious cooperation will strengthen the healthcare system so that it is expected to improve the quality of service to patients. And then good service quality allow patients to be treated faster and recover faster. Costs are reduced, and then maximum service results. The opportunities of nursing development start off self-development, building relationship with other profession, and then nursing science development, practice collaboration, and to be good nursing practice, good nursing practice. Interprofessional education can be a nursing development opportunity. Working with the other professions motivates individuals to learn more about the case being managed. This can increase the nurses' self-development. Communication between profession with handling case it is getting better. In general, can be developed nursing science, and then practice collaboration with other professionals with get the opportunity for good nursing practice. The challenge of implementing interprofessional education in nursing education, as well as in health and community services, the first different level of education, but this can handling with competency improvement, and then different vision and handling with equity vision. So different workflow can handling with learn and understanding and new policies, can handling with socialization for all of them. Level of education of health workers in Indonesia is still very various. There are diploma, bachelor, master, specialist, and doctor. And sometimes it is unavoidable that the collaboration is between diploma and specialist, for example. It's very far. So they must be able to recognize learn work pattern, and then adjust the knowledge there are improve theirs together. Therefore, health workers should be enthusiastic to improve their competence, both through formal or non-formal education, maybe a formal education with a further study, and non-formal in the form of training to increase knowledge, skill, and then difference in vision jeopardize the achievement of goals. So the alignment of perception is important before managing joint activities. And then workflow difference can also hinder job completion. They must learn to understand each other and learn how they work. And last for new policies, The new policies that are enacted sometimes only known by some profession or some people with higher education standards. So socialization to the entire team is necessary for the smooth running of the program. And then these key competencies for nursing. Nursing must be have this competition. The first, communication ability, and then strength in nurse professional role, knowledge professional of other, knowledge of professional role of other, and then leadership, team function, and negotiation conflict resolution. And learning outcome of curriculum meets all competencies. This competency. All key competencies are included in the appropriate course and programs for their implementation. Interprofessional education, learning, expectation from present and future workforce, and then doing interprofessional education, collaborative practice ready health course, and then collaborative practice ready health course. That is to collaborative practice and real practice, and then can be optimal health services. The university vision and mission are certainly future oriented. Must be future oriented. How to bring future health workers with a future oriented curriculum. Support interprofessional education implementation. Trains collaboration between health worker in the practice of managing patient together. Furthermore, they can collaborate with the team when there are already work as health worker in health service. And so the hub can be optimal health services. And then the interprofessional education implementation for nursing education, specific in UMP, can be doing expert lecture relates to case, and practice can be carried out and followed by students from several professions. For example, case of dystocia lecture from obstetric gynecology expert, and followed by medical student, and then nursing student, midwifery student, psychology, pharmacist, and this other. It can be follow with this lecture. The second, research collaboration. In this activity, collaborative research project can be carried out by students across program, across departments. For example, medical and nursing student, or nursing student and psychology students, or midwifery student with a pharmacy student. In Indonesia, For example, students carry out joint research. One of program in Indonesia like the PKM. PKM is Student Creativity Program, which is a national competition grant. National competition grant research and innovation for students. Maybe the research collaboration the same with nursing innovative project in KKU like that. And then community service collaboration. This activity can be carried out when students in community practice, maybe in UMP like KKN, kuliah kerja nyata, KKN, together with students from other programs, other discipline, science discipline, both science and non-science or social humanities. Joint professional practice. Joint professional practice can be carried out when students study professions. The practice of managing case in a hospital or community by several head students from different programs, from different majors. Discussion from a discussion forum is provided starting from the stage of assessment and then determination of diagnosis and then intervention, implementation and evaluation of case. So small group discussion or SGD, small group discussion can be implemented when students with the tutorial method, where at that time there were several students from several majors. And then they discuss the case provided. How about the decision making? How about the decision making in this setting? And the last plenary discussion. Plenary discussion in this section, students carry out joint practice during journal presentation, discussion about some case. Of course, several students from different related program participates. Okay, these are the and the conclusion of the implementation of this interprofessional education can be carried all the undergraduate stage or at the professional or clinical phase or in here profession. And the facilitator provides a case scenario to be discussed in the learning tutorial, and then lecture or teacher preparing, and then team teaching, the modules, assessment instruments, and then evaluation instruments are preparing by program. Okay, I think the last presentation. Thank you. This is the end of my speech today. I hope we can take a good lesson from what I delivered today. And I ask forgiveness for any words and behalf which are not supposed to be. Thank you for your kind attention today. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Ibu Umi, for your insightful topics. Ladies and gentlemen, our respected audience, we are now about to start the discussion session. And apparently we have prepared quite some questions for the speakers. As I have mentioned earlier, we have actually 3 questions from 3 audience for Mem Jin. Let me read again the questions for you. The first question from Ms. Atika. Being as the facilitator in the IPE learning, how to adjust in the learning strategy? I mean, how we as a teacher adjusting the learning strategy, and could you please share the experience from NIUST in the learning process of interprofessional education? And
Yes,
then,
ma'am.
yeah, second question is from Ms. Tina. In order to facilitate the interprofessional education, we have to be a facilitator, not a lecturer, as you stated in your slide, Mem Jin. But sometimes it's hard for us to resist lecturing our students, especially when they are misleading or misled in the IPE practice. What are your suggestions according to this situation? Perhaps you can also share your experience, your faculty experience in conducting IPE. And the last questions would be for Mem Jin again. How to increase the team dynamics, or how to decrease the miscommunication between disciplines? Because as a students, we need to have a basic skills. What are the basic skills we have to practice or sharpen in order to involve in the IPE? Those are the questions for our first speakers. Let's invite again Professor Jin Nunis Gulesper for the discussion session. Mem Jin, are you
Yes,
there?
ma'am. Yes, ma'am. I'm here. I'm back. Good morning. Good morning, Din Umi. Good morning, Ma'am Susan. Good morning, everyone. How are you?
Fine.
Yeah, nice to see everyone here. So I just want to go first to the question of the last participant, which is about miscommunication. Nowadays, we know that our mode of communication is purely via online or virtual, and somehow it is very quite difficult, specifically if you do not talk face-to-face to the person, because the message is quite different when you are talking face-to-face. So in our practice, for us to not have this miscommunication during the time of exchanging messages, we do the post-conference with the students virtually like this, so that we can communicate with them. Even virtually, we can express what we feel, unlike in those messaging system that it can be interpreted as a different one. So in every activities that we conducted, whether it is part of the learning continuity plan of clinical duty, which is currently implemented in the College of Nursing of our university, we do the post-conference. So after the discussion, we usually given them some time to reflect regarding those discussions, and then eventually we will meet after 1 week for us to share those challenges and difficulties they have encountered during the discussion or during the IPE. So if there are questions that arise, we address it during the virtual meeting like this so that we can clarify somehow what are those gray areas that they have encountered. So meaning we have an open communication line, and it is part of the teacher's activity that we have at least 1 hour of consultation with our students as our class advisors, for us somehow to coach them or give them additional information on the topics that are considered as difficult to them. So that is for the first question. For the last question regarding the miscommunication to be prevented. So open communication and telling them that these are the things that we need to do, that we need to adjust somehow in terms of the time, or if we need to adjust the date of the requirements to be submitted online, we do that. That is considered as consideration, specifically in this time of pandemic. Because we, in the Philippines, it is very, it is a big problem, specifically those students who live in far areas or those mountainous areas due to internet connection. That is their very first challenge or problem. So we do give considerations for these students because all we want is to extend help to them, to assist them somehow. And aside from the online teaching that we have, we provide them a specific module for every subjects that we have. So we reach out to them, and we somehow we are flexible, and we know how they feel that in terms of this time that we do not have face-to-face classes, it is quite difficult for them to know those things that they need to know specifically in the clinical setup, which is we have alternative learning. For the question of Ma'am Tina, in terms of our role as teacher in the IPE as facilitator, not as lecturer, what we did in our university is that we do the flipped classroom most of the time, wherein the topics were given to them, both in written as well as written in terms of modules. And then if there are some gray areas, we have our GC or group chat in the Facebook, wherein they can post questions for clarification while they are doing those activities that were given to them as part of the lesson. Meaning to say, in the module, we have different units and different objectives on what to meet for that specific topic. Say, for example, for Unit 1, it is about medication error for pharmacology in nursing. We will provide them Unit 1 for that specific subject, which is pharmacology. And then eventually, at the end of Unit 1, there are some activities specified on how they can perform. And then after the performance, or after answering those questions in that specific activity in Unit 1, they will submit the requirements via online. And then we will check it, and we will give feedback. And after that, we will meet again during the meeting, which is considered as a virtual meeting like this. One by one, if I am handling 10 students in each group, in a group, I need to flash in the slides like the one that we did with Dean Umi during the lecture. And one by one, we will give our critique or analysis on the answers that they have given in the activity. So by then, we will give the positive and negative feedback. And as part of the communication, I am telling them, or we are telling them as facilitator, that these are the good points that you have done. Of course, we always go with the positive feedback for the students for them to boost their confidence and self-esteem. And then eventually, if we notice that there are some things that they did not meet based on the rubrics that we have made for that specific activity, we recommend some activities that they need to do as a follow-up for them to catch up for those questions that they did not answer it correctly. And then we ask them, what are the things that you did not understand, so that we will settle now, so that those gray areas will be cleared and learning will still be continued. So that is how we do in terms of as facilitators. One advantages that we have is that we have a nursing leadership subject wherein a specific senior student will be assigned to this group to monitor their activities, and they are the one who will act as professor or clinical instructor, and they will the one who will supervise in the activity of interprofessional education. But of course, the facilitator is monitoring the activity of the students. So in that way, we are training in a manner that that student, once she or he graduated from the nursing program, she has this ability to lead the group and to teach them, the other students, and to be one of the leaders somehow in a group, to mentor other nursing students. So we usually do that because one of the things that they know is they need to know in nursing leadership and training that we are conducting, which goes hand in hand with interprofessional education, is that they need to act as a leader. They need to facilitate the collaboration between the students as well as with the faculty or with the professor and the other faculty members from other discipline. So that is how we do in terms of what we so-called facilitating or as facilitator. It is quite tiring because you need to adjust somehow. But as we go along with this practice, we learn from ourselves that, as I have told a while ago during my lecture, that I need to talk for 100%, I need to talk at least 10% only, and the 90% is more on listening, because when I listen, that is the time that I internalize those difficulties and challenges that they have met. So during the actual activity, in terms of monitoring, I give feedback, which is not in the term of lecture, but feedback in the terms of, say, for example, if it is a medication error, like what Dean Umi is discussing a while ago, we need to call the attention of the students who is in that specific field, which is the pharmacy student. So giving feedback from me and giving feedback from the student, which is aligned with that specialization, is considered as mentoring. So less talk in my part, because I need to extract some information from this student, which is from pharmacy or pharmacology department or pharmacy department. So that is how we work on. And then in terms of the question number 1, which is the strategy and teaching, as of now, since we have alternative learning, that is, when we speak of alternative learning, in replacement of the community health nursing exposure in the community and in replacement of the clinical duty or hospital duty, we crafted a specific learning continuity plan that there are some activities included focusing on the different learning activities. So may I share again my slides so that I can flash the activities. Is it visible now? So this is just part of the learning continuity plan that we have crafted in the College of Nursing through the flexible alternative distance learning, or the what we so-called blended learning activities. This is specifically for skills laboratory because that is a component of every professional nursing subject that we have. In the Philippines, when we speak of medical and surgical nursing, there is a specific number of hours for clinical duty, and there is a specific numbers for lecture, and specific number of hours for skills laboratory. So it is divided into 3. So for the skills laboratory, for us to somehow a combination of alternative activity for hospital activity and skills laboratory, we use the case-based learning, wherein we use clinical case scenarios that are prepared by the faculty members who are assigned with specific specialization like pediatric nursing, obstetric nursing, medical, surgical, and other areas of nursing subjects. So with this, depending on the year level where they have assigned, we are the first thing that we need to do is to see the year level, if it is 2nd year, 3rd year, and 4th year, because there are different learning outcomes per year level as is stipulated in the CMO issued by Commission on Higher Education, and specifically this CMO is focusing on nursing education. So the faculty or the teacher is the one who made the case scenarios which are similar to the scenarios or cases in the hospital. Like for example, stroke for level 4 nursing students. The faculty member will craft a case scenario specifically focusing on stroke. And then the students will make a case study specifically for that topic, crafting a nursing care plan, drug study, case analysis, and concept mapping, including methodical and clinical review for our 3rd year and 4th year. So after this, we will set a case presentation where they will present this case study to the panelists. And then during the presentation of their case study, that is the time when the faculty members will give feedback based on the observations that they have seen during the presentation. What are the errors, or what are the things that they have not tackled for that specific case. So that is how we do it, and it is only one learning activity. Another one is we have the guided skill practice, which is intended for 1st year, 2nd year, and 3rd year. For this guided skill practice, for us to measure or to evaluate the performance of the students if they have learned something from us during the discussion or posting of videos of discussion in our Google Meet classroom. In return, they will perform specific procedure. They will record it and post it back on the Google Classroom for us to check if all the steps or step-by-step procedure in that specific nursing procedure has been carried out. Like, for example, operating room technique, we will post a video or lecture discussion about operating room technique, how to do the gloving, the donning, as well as how to prepare for wearing those gown, like open gown technique, or how to serve the doctor during the time that we are going to assist in the operating room. So in return, they will perform it through the record videos and submit it to us. And eventually, we will be able to see those recorded videos by the student if they get it correctly. So meaning to say, if they performed it well, somehow they learn something from the video that they have that we have posted in a Google Classroom. But we have rubrics that is being given to the students, or the checklist of the skills laboratory they are going to perform. Meaning to say, those checklist of skills laboratory that they are going to perform are being, the step-by-step procedure are there for the skills laboratory, and how they are being graded was stated in the rubrics, which is the evaluation form for their performance. So this is for the skills laboratory itself. And we also have problem-based learning, which is a component of case-based, the first one that I have given, because this nursing care plan and RUG study is considered as self-directed learning. When we speak of self-directed learning, this is offline activity for the students, where during the case study that they are crafting those activities such as nursing care plan and drug study, they will learn from themselves. They will search a certain topic in the internet, and eventually we have this software who can check if the item they have submitted are being plagiarized. So we will see that the students are doing it well or not because of the software who is checking the plagiarism percentage. So the accepted plagiarism percentage is only 5%, like like in publication of article. So it is being relayed to the students. What are the things to be done? And then we have also inquiry-based learning, wherein the students are being asked to search pertinent relevant facts and studies or journal articles. In our case, we are the one who posted this journal article in the Google Classroom, and we assigned it to them individually. So the output for this is they will going to synthesize the paper. They will make a position paper, and they will analyze and critique it with the rubrics that we have provided to them. And another one is the self-directed learning that I have discussed a while ago, which is an output of this is reflective journaling, wherein they need to mention in the reflective journal, which is not in narrative form, what are the things that they have learned, what are the difficulties they have encountered, what are the learning insights. And this output usually have been saved in their portfolio online, specifically in the Google Classroom. So we also have collaborative learning, which is allotted for 4th year, which is for nursing leadership subject, wherein we have trained them how to become the head nurses or staff nurses in the hospital, head nurses also in the community setting. So there are specific activities that they need to perform. They are the one who will provide the lesson plan for the students that they are being handled, and then they will submit it to the clinical instructor or professor to check if those proposed activity are okay for this specific number of students. And then we also have clinical simulation, which is comprises of conditions that attempt to present clinical cases scenario. So here we use our high fidelity mannequin. There are 10 scenarios there, almost 20 because we have, I guess we have 30 clinical scenarios because we have at least 3 mannequins that we can use in those case scenarios that being provided to the students. So in clinical simulation, we usually do the scenario online, and then they will give some feedback by making some comments and learning insights also. So these are given by the clinical instructors assigned to the group of number of students, which is with maximum number of 10 students. So there we have 1, 2, 3, 4, 5, 6, 7. We have 7 learning activities that we are conducting or carrying out, both for skills laboratory and alternative clinical duty. I hope I answered the questions of our participants. Thank you very much.
But Ma'am Jen,
Very
really the implementation of interprofessional education in hospital is not
yes,
so
ma'am.
optimal. Yes, not so optimal. Really, the implementation of interprofessional education in the hospital is not optimal because of the many agendas and difference in practice time.
Yeah.
And need assistance and follow up by a clinical instructor. Yes, right. That. Assistance and follow up from clinical instructor.
Yeah, there is an assistance with the clinical instructors, and then eventually the overall coordinator in charge for the clinical, because we have the what we so-called clinical coordinator or clinical unit head, which is in charge to supervise all the students and clinical instructors having this clinical online duty now.
Yeah.
Thank you so much, Ma'am Jean. You have given a very thorough explanation as well as detailed example. Okay, ladies and gentlemen, we're now opening a direct question session. Is there any audience who wants to ask the speakers directly? Anyone from the audience? Oh yeah. Okay, apparently there is an audience who wants to ask a question directly to the speaker. Please. Mbak Novelia, dipersilakan. Miss Novelia, are you with us?
Maybe mute the sound. Really?
I'm sorry, but she's not. She's no longer with us right now. Previously, she raised her hand in the Zoom, but when I'm looking for her, she suddenly disappeared. Anyone else?
Maybe it's enough. Can a question by WhatsApp with a committee maybe? Oh, Mbak Sekar Ayu.
Yeah.
Mbak Sekar Ayu.
Sekar Ayu, please.
Yes, ma'am. Hello. Can my voice be heard clearly?
Yes, ma'am.
Oke, Assalamualaikum warahmatullahi wabarakatuh. Selamat siang, magandang hapon, Ma'am Jen. I'm Sekar
Magandang
Standing
hapon.
Room. Yes, I'm Sekar Standing Room from UMT student, and I have a question to Ma'am Umi. Okay, we'll understand that UMT Vikas is a fairly large faculty because it consists of 10 to 11 study programs. If learning is related to IPE, is it possible for us to learn other things, for example, nursing with electromedical or entrance? Thank you, Ma'am Umi.
You're welcome, Mbak Sekar. Okay, thank you. You're right. At UMP, interprofessional education is possible to implement it by head study program, pharmacy, medicine, health science, psychology, and for example, nursing and electromedics, or nursing, midwifery, management informatik, and its other. Yes. In UMP, many program to that, tutorial, and then expert lecture, and its other. In laboratory, possible too. Okay, Mbak Sekar.
Okay, thank you, Ma'am Umi. So thank you so much, Ma'am Umi.
You're welcome.
All right, Bu Umi has answered Ms. Sekar's questions. Is there anybody else who wants to address the questions to the speakers? Perhaps I will wait for a while. Okay, ladies and gentlemen, our respected audience, while we're waiting for the questions from the audience, I will read the summary of the topics from the three speakers as a lesson learned for us. From the first speakers, we learned that IPE in clinical and community setting is very essential because it will prepare the students for practice to effectively collaborate with interprofessional team members to improve healthcare outcomes. And there are 5 competencies of IPE which are prepared by the institutions. They are roles and responsibilities, ethical practice, conflict resolutions, communication, and collaboration, as well as teamwork. And to address those, to achieve those competencies in the learning process, the students are facilitated with variety of environment, challenges of team dynamics, and then grouping, facilitators, activity designs, and assessments. Those are the things that the institutions facilitate or conduct for the students to emerge in IPE learning. And from the second speaker, Ajahn Wasana from Khon Kaen University, Thailand, we know that the nursing students have to finish the IPE module for 124 hours. And in Thailand specifically, for over 2 decades or 20 years ago, they have started to conduct the IPE learning process. In KKU or Khon Kaen University, they started with community medicine, or they abbreviated with COMMED. It was a collaboration of IPE learning process between the Faculty of Medicine and Faculty of Public Health.
later on, other faculty science joined the learning process for IPE, such as Faculty of Nursing. And they also involve the local wisdom for the students to learn in the healthcare community setting as well as clinical setting. And we know from Ajahn Wasana that they also have challenges and as well as opportunities in conducting IPE learning process, such as they need responsible faculty members to manage the subject and then to find the right time for everyone to involve. Next is to expected outcome of each disciplines, because other study programs may have different outcomes for their students, and also health problems in the same community. They need to explore the health problems, as well as the curriculum organizing. It's not easy to organize curriculum. And the last but not the least, from the third speaker, we learned that IPE is also very important because a while ago or previously, there are many obstacles which led to medical error in the clinical setting, such as poor leadership and management practice, poor communication between health professionals, also poor clinical reasoning, problem solving, decision making, and also poor teamwork. So we also face some opportunities as well as challenges in the healthcare service, such as strengthening healthcare system, improving the quality of patient care, reducing the cost of care, shortening the length of stay of the patients, as well as improving healthcare outcomes. And the challenges that we are actually facing in the IPE learning process are a different level of educations, which can result in different visions. That is why we need to improve the competency of our students. Next will be the changing of new policies, as well as different workflows of the healthcare professional. That is why we need to socialize our program truly to many parties. So again, I will address if there is any question for the speakers. If we don't have any further questions for the speakers, I, as the moderator, will close these panel sessions. Ladies and gentlemen, those are the infallible knowledge regarding IPE that we have gained from the three speakers. And I hope during this two-day conference about challenges and opportunities of interprofessional education across countries, we can acquire a lot of insights. And more importantly, we can adapt as well as implement a better IPE in our institution in the near future. And not to forget, I, Susana Widyaningsi, as the moderator of the second day, would extend our gratitude to our respected speakers, especially to Ma'am Jin from the UST Philippines, to Ajahn Wasana from Konkan University, Thailand, as well as to Ibu Umi from Faculty of Health Sciences, UMP. And I would like to send my apology if there is any shortcoming in guiding these panel sessions. And later on, I will give back the stage to the Master of Ceremony. And I would say, have a good day. Thank you for your attendance as well as your participation in our conference. We would like to see you again in our third international conference in the next years for more challenging and interesting topic. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Thank you and congratulations. Thank you. Thank you, Din Umi. Thank you, Ma'am.
Thank you, Ma'am Jen.
Ma'am Jane, Ibu Umi, before we leave the Zoom, we would like to have a photo session with the audience as well as some community members. Okay, yeah. One more thing that we would like to hand over the certificates for speakers virtually. So please stay for a while. Thank you.
Are you ready? 1, 2, 3. Next slide. 1, 2, 3. Next slide. 1, 2, 3.
Kalau menanya Izat dapat beasiswa karena prestasi, aku laban ya Bu.
Thanks to the moderator who has guided the panel and discussion session. Allow us to extend our gratitude to the speakers who have delivered their materials in the second day of the second International Nursing and Health Sciences Conference 2021. Before we end the panel session, we will hand over the certificates for conference speakers and the moderator virtually. The first is the certificate of Prof. G. Nuts Gilasper. Next, the certificate for Assistant Professor Wasana. And this is the certificate for Associate Professor Dr. Umi Soliha.
Thank you. I received the certificates.
And the last, let us hand the certificate for Ma'am Susan as the moderator of the panel session. Ladies and gentlemen, let us give a big virtual applause to all of them. Hopefully, the topic that have been presented can add a deep insight to all of us. Now, we will announce the best oral presentation from each room. First room, Irnawati from Lincoln University College Malaysia, and Beni Arif from Universitas Muhammadiyah Petajangan Pekalongan Indonesia. Second room, Agustini Song from Universitas Jenderal Sudirman Indonesia, and George Mauricio Rivera from Nova Ecija University of Science and Technology, Philippines. Third room, Hela Meldi Tursina from Universitas Subandi, Indonesia, and Dina Siti Nurjana from Universitas Muhammadiyah Purwokerto, Indonesia. Fourth room, Rimac Pedro Galiondo from Nova Ecija University of Science and Technology, Philippines, and Putri Purnama from Universitas Muhammadiyah Purwokerto, Indonesia. Fifth room, Joshua Antonio Rilo from Nova Ecija University of Science and Technology, Philippines, and Dea Altariani from Universitas Muhammadiyah Purwokerto, Indonesia. Sixth room, Hernas Titi from Universitas Muhammadiyah Purwokerto, Indonesia, and Jose Gonzalez from Yuva Ecija University of Science and Technology, Philippines. And seventh room, Winda Widyastuti from Universitas Muhammadiyah Pekajangan Pekalongan, and Intan Parulian from Universitas Binawan Jakarta, Indonesia. The last event is closing. Let's close the second International Nursing and Health Sciences Conference 2021 activity on the last day by reading Hamdalah together. Alhamdulillahirabbil alamin. We are, as the master of the ceremony, on behalf of all the event committee, would extend our appreciation and send apologies if there have been any shortcoming from this event. See you again in the third International Nursing and Health Sciences 2022. Billahi taufiq wal hidayah. Nun wal qalami wa mayassurun. Fastabiqul khairat. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.